Before we start, we acknowledge that Ottawa is located in unceded territory of the Algonquin and Anishinaabe Nation, whose culture and presence have nurtured and continue to nurture this land. We do not have any regrets, so I will ask the committee coordinator to call the roll.
Councillor Brockington.
Here.
Councillor Brown.
Here.
Councillor Carr.
Present.
Councillor Hill.
Present.
Councillor Kavanagh.
Present.
Councillor King.
Here.
Councillor Lowe.
Here.
Conseillère Plante.
Allô, allô.
Councillor Troster.
Here.
Vice Chair Bradley.
Here.
Chair Dudas.
Present.
You have quorum, Chair.
Thank you very much, Eric. We do have a declaration of interest in related to item 4.1, the budget. There's two items. Councillor Hill, would you be able to read that in at this point?
I can if it gets put up on the screen.
We can get it up on the screen, no worries.
Thank you.
Just pulling it up now, Chair.
Thank you very much, Madam Chair. I, Councillor David Hill, declare a potential deemed indirect pecuniary interest on the following portions of the Community Services Committee CSC 2026 draft operating budget: Community and Social Services Department, Children's Services Operating Resource Requirement, Wage Enhancement and Workforce Comp, and Canada-wide System, CWELCC, line items, page 10 of the CSC budget book, as my wife is employed by an organization that will receive funding from or would be eligible to receive funding from these budget line items, and recreation, cultural, and facility services, complexes, aquatics, and specialized services, operating budget and user fees, pages 34 to 37 of the CSC budget book, as my daughter is employed by the Recreation, Cultural, and Facilities Services Department in the service that receives funding from this area of the budget.
Thank you very much, Councillor Hill. We'll move to 3.1, which is the CSC minutes for October 28th, 2025. Is that item carried? Okay. So because we have we have a number of important items on the agenda, but we have a number of delegations, 17 in total at this point for our operating and capital budgets. We are going to hold that item. I'm going to run through the consent agenda, and that will include the IPDs. I know that some of my colleagues wish to lift those onto the agenda. So what we will do is we will vote on that now, because we do have one potential delegation associated with one of the IPDs, and that will give them a sense as to how long to stay for the day, or if it's not being discussed today, to come discuss it with us another time. But we will continue to keep the IPDs at the end. Does that make sense? So we'll go through it all, give people a sense of what's to come, and then we're going to return to the budget document. So we're holding item 4.1, which is the budget. Okay, and we just got it carried. Okay, everybody's good to go. No, I'm just teasing. I'm teasing. All right, 5.1 is the long-term care accreditation governance standards. There is no presentation. Did anyone have any questions or comments in respect to that? Is that item carried? Carried. We have 6.1, which is the status update, community services inquiries and motions for the period ending November 7th, 2025. Any comments or questions? No. Is that item carried? Okay, we have no in-camera items. 8.1, this is the one of the IPDs. This is the use of delegated authority during 2024 by Recreation, Cultural, and Facility Services Department as set out in Schedule E of Bylaw 2023-67. Is that received? Received. 8.2 is Mooney's Bay Park Hill Modification Study. I understand that Councillor Brockington is asking for committee's indulgence to lift this onto the agenda. Is that
I'm just wondering
Those.
today, I'll take your direction. I just have one question to ask. I'm not sure if it needs to be lifted or if I could just ask my question and we can move on.
Is it a short question?
Yes,
Do you want to ask it right now?
yes.
Okay.
So thank you, Madam Chair. So I appreciate the staff memo that came out last week and the three options that the professional consultant provided. What would be the logical next steps to go from here? Obviously, council has not entertained this idea. There's no money on the table, but if this matter were to go forward, what's the next logical step?
Chair, the natural next step would be to have a discussion in terms of which of the three options would best meet future needs for the site. That could include a community discussion. It could include some ideas on modifying what is there, because this is three options that are potentially possible to build, but there may be other ideas in terms of what that would be. Once that is done and a clearer idea of what the community intent is for the site, then detailed design, which would involve more consultant services at additional cost to design the final product and produce tender-ready documents to build whatever we decide on.
Madam Chair, for today, that is sufficient for me at this time. Thank you.
Thank you very much, Councillor Brockington. So is that item received then? It's an IPD. We're good to go. The other IPD is 8.3, use of delegated authority during 2024 by the Community Social Services Department under Schedule D, City of Ottawa Bylaw 2024-265. Is that item received? 8.4, it is the Alternative Neighborhood Crisis Response Anchor, and I understand Councillor Troster would like to lift that onto the agenda with the committee's indulgence. Is that the case, Councillor?
Yes,
Okay.
thank you.
Does committee concur with that request? Yes? Okay, so we will lift that onto the agenda. That will stay to the end. So if that delegation would like to come back, I'd like to say in a little while. We do have a number of delegations, so we'll give you a bit of a heads up. I'll have the committee coordinator reach out to you. Okay, wonderful. So we are going back to our budget. So 4.1, we have a phenomenal, incredible presentation from Cyril Rogers, who's on his fourth budget meeting so far, only 5 left to go. He was sharing with me, so he's not quite halfway through, but he said he saved the best for today. So Cyril, no pressure. No, take it away.
Thank you, Chair. And full disclosure, that's what I tell all the chairs. But in good fun. So you can move to the next slide. So today, consistent with the process that we've been following, trying to have some kind of normality to the presentation so it's easier to follow, not only for committee members, but for the public and the residents that do attend these committees. So go through a little bit of an overview of the committee's budget, talk a little bit about the operating, the capital side. Then I'll pass over to my colleagues, Clara, Dan, and Andrea, to kind of speak to their specifics. This committee is made up of 2 bigger departments and then a small piece from Public Works on the park side. So that's why it's kind of a little bit more than your standard 1 or 2 departments. So next slide. So overall, this committee's budget is $1.6 billion. It's one of the larger. It is actually the largest committee budget that we have at the city. What that means overall is a 6.4% overall. And if you break that down, Dan's shop is going up by 4.5%. CSSD is up by 7.1%, and Parks is increasing by 3%. So as I spoke about before, we don't arbitrarily allocate every department the same percentage increase. We go through a very complex process in terms of priority needs. Just for those that were at previous committees, Planning Committee increased by 3.5%. EPS went up by 7.34%. Yesterday at Transit, that budget increased by 10.8%. So again, every committee budget goes up by different factors. There's different funding sources. And again, we do not arbitrarily allocate a flatline tax increase. This budget does have 128 million in recoveries and allocations. That's mainly in RCFS. So this is where mainly the facilities costs. So all the costs for all the city facilities is through Dan's facilities budget. Then we allocate that back to the respective departments. On the revenue side, Again, a very large revenue, and this is mainly in CSSD and Clara Shop. So this is all the mainly provincial funding, just close to 900 million in terms of those services that we do from a provincial perspective, bringing it down to a net requirement of just over $500 million. In this budget, we do have additional 23.43 FTEs, two areas, 21.43 FTEs in children's services, and 2 additional resources in long-term care for nurse practitioners. These are fully funded from provincial funding. So this is, again, funding from the province and very much in line with the motion that was passed during directions report. The capital budget overall is 235 million, mainly in Dan's shop. There's one big project in there. That's the Riverside South facility, just shy of 140 million. Then there's significant investments again into our buildings across the portfolio. We do make significant investments in the buildings across the organization on an annual basis, and that's the total there. Consistent this term of council, we do break down projects that have a minor, moderate, or major contribution to climate change. New this year in the transmittal report. So again, that's one of the documents that we table on tabling day. If you go to one of the supporting documents, document 5 or 6, what we've done this year is basically we've consolidated all the capital projects by department and identified the climate change impact. So it's all summarized, as opposed to in previous years, you'd have to do a page flip and kind of do it all up together from the feedback that we heard last year. So we did a kind of a new document. So it's all nicely summarized in that document. Next slide, please. This slide, next slide, is basically just, a breakdown of the 1.6. The biggest share, no surprise, is in CSSD, 1.2, the largest share of the overall gross budget there. And again, as I mentioned previously, the $1 billion worth of revenue is mainly from provincial sources in this one. And you can jump to the next slide and I can kind of bridge the gap of the residual $70-80 million, which is basically revenue in Dan's shop for all the user fees. So this is all your camps, skating lessons, swimming lessons, facility rentals, etc. And as I mentioned on the previous 2 slides, the recoveries is basically all the costs that come in through the facilities, and then we allocate that back to the different departments. From a parks perspective, we bundled it here. We call it out separately, but we didn't create another slide just for parks. Parks is in public works, but we put it on this slide just to kind of shorten the package a little bit. So the parks budget is 77 million, which is an increase of just over 3%. Next slide. On the capital side, so this is how the capital is funded, $235 million capital program this year. Biggest chunk is on development charges. And this is isolated to mainly one project. That's the Riverside South. That project is DC eligible. So that's where we use DC and DC debt for that big project. We do have a little bit of revenue, not a lot, 7 million. These are 2 main projects. It's the Larry Robinson Arena and Optimus Park. These are 2 projects where we have some funding through grant programs that we flow through, and you see that that's where the revenue comes from. And then the reserves, this is basically the cash contribution that we take out of the citywide capital reserve to fund these projects. Next slide. So a little bit breakdown by department from a capital perspective. And again, a little bit repetitive, but no surprise. Lion's share of the overall envelope does go to Dan's area in terms of the buildings and parks. Then there's just some residual type funding in Clara Shop and childcare, long-term care. Next slide. So as committed at tabling, so with the 44.9, I think it is, overall efficiencies in this budget, this is the component that you would see in this committee, 6.68, so $6.7 million across the board. The workforce management strategy, so this is basically, kind of leveraging the gapping. So as a reminder for those around the table, at the city, we basically budget for a full year complement. So if we have 17,000 FTEs, we budget as if those 17,000 employees will be here from January 1st through December 31st. We know that never happens. There's attrition, there's retirements, there's turnover. Corporately, back in 2016, 2015 timeframe, we established a gapping target around 3%. Not every department is allocated a flat 3%. It depends on the service. We do adjust it to the service needs. In this budget, we've increased the overall allocation by 0.5%, and we allocated that across the departments based on what we're seeing from a hiring vacancy perspective. Going into the pandemic, obviously, we had a lot of vacancies coming out of the pandemic in 2023, 2024. We did see some improvements. What we're seeing this year in 2025 is a longer time to find staff. It's the nature of the market. When you look at the federal sector making significant job cuts at the beginning of the year, the tariff issues really created a lot of uncertainty in the marketplace. Then, of course, the federal announcement with their job reductions. So we're seeing a little longer for hiring perspective to attract talent. People seem to be staying where they're at. So because of that, we're seeing some significant savings in 2025 because of vacancies and holding jobs a little bit. So that's where that allocation comes from. On the facilities operations efficiencies, that's mainly on the utility side. One of the bigger drivers there is natural gas. The carbon tax, the carbon tax is creating significant savings on our fuel, but also on our natural gas side of the equation. So that's where you see the facility savings mainly from there. The fleet efficiencies is a little bit on the fuel. This department doesn't have a lot of vehicles. Dan's got most of them. I don't think Claire's got any vehicles, but is only small in terms of the overall quantity. And then discretionary savings, as I talked about through the year, my quarterly updates, we do have a discretionary spending freeze in place. It's kind of been in place now for 3 or 4 years. And these are really savings from training in the realm of where we can do training via virtual or the web or in bigger groups. We still do send people or staff to key conferences where needed. Savings from office supplies, printers, those kind of non-operational type costs that we can garner some savings from. So again, overall, 6.7 in efficiencies in this committee. With that, I'll now pass it over to my colleagues. Next slide.
Thank you, Cyril. So good morning, members of committee. I appreciate the opportunity to present the Community and Social Services 2026 draft operating capital budget. Bonjour à tous les membres du comité. Je vous remercie de me donner l'occasion de vous présenter le budget
I thank you for allowing me to present the draft budget for 2026.
My gratitude to Cyril and his team for the amazing teamwork that's gone on behind the scenes in preparing for this budget. And of course, I need to acknowledge my CSSD team for preparing for today. So thanks, team. Over the past year, we've made, and I'm very proud that we've made systemic and structural changes that focus on the long term, sustainable and positive outcomes. For instance, increasing permanent transitional housing beds by 700 units, approving an older adult plan with a long-term view, changing how we serve in terms of person-centered care and long-term care, and overshooting on the number of supportive housing beds by 180 beds between 2023 and 2025. And we're working with municipal and provincial partners and associations to advocate for real policy change in order to get more money into the pockets of people who need it the most and improve access to services. Mais en même temps, nous savons que la communauté subit des pressions de plus en plus accrues.
We know that the community is pressured, especially the most vulnerable and the more sensitive to local and global changes in the social-political structure.
In 2025 alone, the Ottawa Food Bank and member agencies have seen an increase of 101 visits since 2019. The number of individuals experiencing unsheltered homelessness is estimated at 510 people. This has increased from 190 unsheltered individuals since 2021. These are very tough times. The issues we face as a community are complex, and Community and Social Services could not address them without the support of partner organizations, hundreds of organizations that we work with. And we couldn't succeed without the funding and policy support of the provincial and federal governments. Le budget de 2026 continue de faire
The 2026 budget is still focused on our priorities and the city's strategic plan, thanks to investments in housing and community welfare and support of vulnerable people.
More specifically, in the draft budget for Community and Social Services, we have $4 million increase for social and community housing to support the goals of the 10-year housing and homelessness plan. $2.18 million for essential health and social supports. And this city-funded program helps residents maintain stability, safety, and dignity when they need it the most. The majority, 85% of the clients of this program are seniors over the age of 60. $700,000 is in the draft budget to help us accelerate the expansion of the alternative neighborhood response model. This model was informed by the recommendations of the Abdirahman Abdi inquest. This non-police community-based crisis response for mental health and substance use received 4,464 calls in its first year. The investment will assist in expanding the program service area next year and help us plan for future expansion. $478,000 is in the budget for additional increase for food security initiatives for a total CSSD investment in food of $5.5 million in 2026. This $476K represents an additional investment above the inflationary increase of 2.5, resulting in a total 15% increase in food security funding. The draft budget also includes ongoing investments in poverty reduction to help us implement the poverty reduction strategy, with another $150K one-time investment to coordinate income tax clinics. And in the first year, Financial Education Center, EBO, and its network of 10 partners reported filing over 6,300 returns, tax returns, unlocking a staggering $30 million in benefits for people. It's an amazing investment. We have $400,000 in the draft budget that will be an initial investment towards the goal of ending youth homelessness by 2030. This funding will launch the provision of diversion workers, training and coordination, with a plan coming as part of the 10-year housing and homelessness plan in the new year. And as Cyril mentioned, the budget also includes provincially funded staff resources in children's services and long-term care. In children's services, these will help us grow approximately 600 new childcare spaces in 2026 through the Canada-wide Early Learning and Childcare Program, and for additional nurse practitioners in long-term care. Both are critical to improving service quality, delivery, and equity. These investments in our community advance the term of council priorities, working towards a city that has affordable housing and is more livable for all. La Direction Générale des Services Sociaux et Communautaires s'engage également
Our department wants to improve the services to community.
Our corporate partners with service review and continuous improvement programs to find efficiencies, including in the point-in-time survey of 2025, transitioned to digital format from paper. This resulted in cost savings and improved collaboration with community partners, and of course, more accurate data collection. And in employment and social services, we've implemented a secure file digital tool to streamline documentation processes. This tool improved document tracking, enhanced confidentiality, reduced administrative time, and lowered costs. Ces initiatives nous permettent d'optimiser le travail quotidien, de nous mobiliser davantage.
This resulted in a reduced administrative time, improved document tracking, and enhanced security for confidential information. We are proud of serving this dynamic community and to present this budget that shows all the efforts that were made for an equitable and safe future in Ottawa.
Thank every member of our Community and Social Services Department for their dedication and professionalism, the incredible work they do each and every day, providing and delivering services and programs that make a difference in the lives of people in Ottawa. Thank you. Megwich, merci. I'll pass it over to Dan.
Bonjour, Madame la Présidente. Good morning, committee
Good day,
members.
Madam Chair.
The RCFS budget for 2026 has a year-over-year change that primarily focuses on two things: compensation and revenue. On the compensation side, we are fortunate that in 2025, our HR department has been able to negotiate 3-year collective agreements with both our part-time recreation and our summer aquatics collective bargaining units. This has provided us with 3 years of certainty in terms of compensation costs. Another excellent development has been the merging of the year-round part-time recreation and culture with our summer aquatics, which in previous budgets, council will have heard that there was a discrepancy between the wage levels that had some recruitment and retention issues that will be resolved as a result of this new development, and will provide some cost savings in terms of not having to negotiate 2 separate agreements with this. The agreement calls for a 3% increase in wages for our part-time staff over 2025, 26, and 27. And a good portion of the escalation of costs in the department for this year is, in fact, the reflection of that collective agreement. On the other side of the ledger, our recreation and cultural fees are going up by 2.95%. And this is a reflection of the fact that our most direct input into providing those programs is part-time wages to staff. As members of council know, most of our programs are offered on a cost recovery basis. And so as wages increase and other costs increase, so do our our registration and admission fees to reflect the cost recovery of those programs. Some programs are subsidized, and that is reflected in the fee itself. But for the most part, we escalate the two in tandem. In terms of budget highlights, last year's budget, we talked about providing the Anishinaabe Algonquin host nation with some support to help deal with the increasing demands that the city has put on them in terms of consultation, both through our cultural circle in terms of cultural matters, commemorative namings, advice on and direction in terms of cultural matters, but also more broadly, the circle has become, at least for now, a venue to have a good dialogue with host nation. This funding will go to host nation to be able to hire someone to help support the work that they do with us in terms of ongoing relationship and the many initiatives we're working on together. The 2026 budget also includes $290,000 that will help us provide cost of living increase to the groups that are funded under our cultural funding program, as well as our renewable recreation program, allowing them to keep up with things like escalating wages and other costs that go into their programming. We're happy to see that the capital budget includes $1.3 million to continue to help support community projects and partnering with communities through the Community Partnership Major and Minor Capital Program. That is usually fully subscribed as a very popular program. And as Cyril mentioned, our capital budget has some significant investments in them, the Riverside South Recreation Complex being the major provision in this year's budget. But there is also funding in the 2026 budget for 3 large district parks at Francois Dupuis, Fernbank, and Riverside Core, which will provide new multi-amenity parks in the outlying areas of our city. In terms of service review and continuous improvement, RCFS has been working with the Mayor's Task Group on Service Review on facility rationalization. The 2026 budget reflects $240,000 in reduced facility operating costs for facilities that were no longer in use and are being either decommissioned or repurposed. In addition to those savings on the capital side, there is also the obvious savings in terms of not having to spend to renew and rehabilitate these facilities as they age out. We are also working through the Agile Government Task Group on new sponsorship and advertising revenue, and 2026 promises to be a year where significant contracts, including things like renewal of naming rights for some major assets, pouring rights across the city for cold beverages, vending, as well as some select advertising opportunities on billboards and digital boards, all of which are promising in terms of bringing in new revenues to the city to offset costs. As well, we are maintaining in this budget some of the programs that we have to facilitate and support access in terms of the hand-in-hand program, which will provide about $1.3 million in subsidies for those registering in our programs, as well as several other programs that help support groups with access to facilities, to parks, and to a variety of other resources that the department can provide. Merci beaucoup, Madame la Présidente. I'll pass it over to Andrew.
Thank you so much. I will give the floor to my colleague now.
Thank you, Dan. Good morning, members of committee. My name is Andrea Lancia. I'm here today on behalf of Alain Gauthier. He is the General Manager of Public Works, as you know. I am the Associate Director of the Parks Maintenance and Forestry Service. So I will be speaking specifically to the Parks Maintenance draft budget for 2026. I'm also joined by my colleague, Ali Downs, who is behind me, and she'll be here to answer questions during the question period if required. Parks Maintenance maintains more than 4,500 hectares of parklands, which includes public parks and spaces, as well as more than 800 sports fields. This year's Parks Maintenance budget consists of a $2.3 million increase from 2025. This increase will support operations and maintenance at new parks across the city, as well as new amenities at existing parks such as splash pads. It also supports grass cutting on new property along roadsides and along boulevards. In addition, this budget includes a $350,000 capital investment, which will support repairs, refurbishment, and the purchase of outdoor park assets and equipment. This will enhance our public play spaces for the community and will complement the more comprehensive ongoing work that's underway by our partners in asset management. Finally, this year's new enhanced ball diamond work will continue. In 2025, Parks Maintenance introduced a new annual process to inspect ball diamonds prior to seasonal opening. We trialed as well a different approach to ball diamond maintenance. So these will continue in 2026 within our current budget. Thank you. Next slide.
That concludes our presentation.
Wonderful. Thank you very much. So before we move to delegations, I'm going to have the motions read in, as well as a direction from Councillor King, just to get everything out there. And then we'll come back to it all at the end after we've heard delegations and had an opportunity to ask questions of staff. So I will ask Vice Chair Bradley to read in to start the technical amendment.
Thank you, Chair. Be it resolved that the table Children's Services user fees be replaced with the corrected table attached to this motion and on file with the City Clerk at each of the following pages: Community Services Committee Full English Book, page 12, Community Service Committee Condensed English Book, page 12, and Community Service Committee Condensed French Book, page 15.
And then what we'll do is I'll ask Vice Chair to read in the introduction of the roadmap, and the committee coordinator will put it on the screen. When it comes time to vote, we'll go through item by item, or we can do it in chunks. I'll determine how we go from there. But if you want to just do the intro part, Vice Chair.
Thank you, Chair. Be it resolved that the Community Services Committee recommend that Council sitting as Committee of the Whole on December 10th, 2025, approve the Community Services Committee portion of the 2026 draft operating and capital budgets as seen on screen.
Okay, thank you. And Councillor King, if you want to read your direction in.
Thank you so much, Chair. Childcare remains a critical priority for Ottawa families, yet operators across Ontario continue to face significant uncertainty. Disputes between the provincial and federal governments over funding under the Canada-wide early learning and childcare agreement have delayed progress towards the original goal of a $10 a day childcare. Fees are now capped at $22 per day until at least December 2026, and many new created childcare spaces fall outside the fee reduction program. This situation places undue pressure on families and providers alike, highlighting the urgent need for stable, predictable funding. Staff are directed to, one, continue working with both the federal and provincial governments to secure funding under the Canada-wide Early Learning and Childcare Agreement, and two, advocate to federal and provincial governments for the financial support necessary to make quality childcare truly accessible and affordable for families in Ottawa. Thank you, Chair.
Thank you, Councillor. Does anyone else have any other motions they want to read in at this time? No, seeing none. All right, we'll move to delegations. As I mentioned before, we have 17 delegations. We also had a handful of written submissions, which very much appreciated people sharing that. I would like to invite Henry Hankelin from the Ottawa Baseball Infrastructure Improvement Group to come speak with us. Hank, thanks for being here. It's wonderful to have you. I see your slides are up. You're ready to go at any time.
Thank you. Good morning, Madam Chair and councillors. Thank you for the opportunity to present again this year. The Ottawa Baseball Infrastructure Improvement Group advocates on behalf of thousands of baseball players of all ages in 17 baseball organizations. Last year, we presented on the need to improve our baseball fields and the maintenance. And this year, we want to provide some feedback on how that's going. Next slide, please. 2025 was a pivotal year. We've had regular meetings now between the city staff and our representatives, and it is being proved very fruitful. It is proving to be an effective forum for discussion, exchanging information and ideas, and testing accepted norms. The trial deployment of the casual employees has provided insight into what is possible as their role developed and became more focused on the priority maintenance. All the OBIG members are grateful for the repair and the maintenance to the work done on many fields in 2025. And that brought them back up to par. We're looking for the maintenance to keep them up to par on an ongoing basis. A plan for future repairs is anticipated and very much appreciated. And finally, staff's genuine desire and commitment to better understand and objectively assess the current operations and practices will provide the opportunities for improvement and is a basis for optimism. Next slide. So looking forward to 2026, we want to continue those communications with the staff. We want to initiate some of the workshops between our members on specific items and where we can really drill down into the opportunities. And we're looking for continuous improvement towards something that's sustainable, it's cost effective, and for our maintenance and management of baseball fields and our sports fields in general. And finally, we'd like to thank for the support of this committee and the response from staff. Many of them are here today. Thanks.
Thank you so much for sharing that, Hank. Oh, you have a question from Councillor Carr.
Thank you very much for your delegation. So what I understand is that you're happy with the level of service that you've received since coming here last year?
Oh, sorry. It's nice to come and give a bouquet when it's deserved, and it definitely is. To you, Marty, on some things that you did as well, but the staff, Allison Downs, and all of the folks that have met with us, we are very pleased. Maybe you could say we hit a home run, but the game's not over. The game is ongoing, and so we're looking forward to our ongoing relationship and meetings and progress. And we thank you so much.
I really appreciate you coming here because I know we had a discussion last year before you delegated, and I know we hooked you up with Dan and Alain, and it's really, really positive for you to come here today and tell us that was successful and that your intervention was successful, because I'm sure delegates get frustrated from coming here again and again, saying the same thing. So it's really nice to hear from people who see that their interventions made a difference. So thank you very much for your engagement and all you do in the community.
Thank you.
Thank you, Councillor Carr. Councillor Hill has a question.
Yeah, thank you very much, Madam Chair. And I really just want to reiterate the comments you just heard from Councillor Carr. Very appreciative of the proactive engagement from the Ottawa Baseball Infrastructure Improvement Group, especially Hank, our regular engagements on this topic. I know that we're striving to make improvements. We've had some improvements. We still have a ways to go, but that engagement continually refines our ability to, talk to other municipalities, see how, other people, other organizations, other stakeholders do this type of maintenance work, how those, those relationships between our sports organizations, our public works teams, our, private contractors, and how that complex interface when you go from, one or two different facilities to hundreds of facilities across the city, that there are challenges of scale that come with that. And I do appreciate the engagement that we continually have on that. So thanks for coming out today. Appreciate it.
Thank you very much, Councillor Hill. Thank you for being here. I was racking my brain for a baseball analogy after your home run, and I'm lost. So probably a couple delegations later, I'll come up with something witty, but it's too late now. Thank you for being here. Your presentation was a home run. I'll just steal yours. Thank you so much for being here. Appreciate it. I'd like to invite our next delegate, Ana Maria Cruz Valderrama, to speak.
Good morning, Madam Chair, and good morning all. My name is Ana Maria Cruz Valderrama, founder and director of New Beginning, a small organization serving the Spanish seniors, and I am also a member of the Accessibility Advisory Committee. I begin my remarks by acknowledging the participation of Councillor Jessica Briley, Riley Brockington, Sean Menard, and Teresa Cavanaugh to New Beginnings Mother Day celebration at the Albion Harrington Recreation Center. They had the opportunity to appreciate firsthand the impact of the purchase of chairs and tables for this facility. Seniors acknowledge the support received from the Older Adult Plan and the small allocation from the city's sustainable grant. Seniors also spoke about how they engaged to perform various duties. Thanks to the Accessibility Office and the Older Adult Plan for the economic chairs purchased and now available at 4 senior centers and the Accessibility Office. This acquisition facilitates a more active in-person participation for people requiring accommodation. Thanks to Councillor Briley for her role in achieving 6 location pilot project for accessible parking spaces that will be implemented next summer, giving people with disabilities opportunities to increase a more active social lifestyle. Thank you to city staff at the Albion Harrington Recreation Center and the Andrew Hayden Park for the kind support, while members of New Beginnings enjoy social gatherings at this location. Thank you for the hard work done for the renewal of the Older Adult Plan 2025-2030, a plan that consists a community partnerships approach aiming at providing better services for older adults. Thank you for increasing the Older Adult Plan budget by $150,000, the first increase in this 30 years of existence. Have an open dialogue with city partners over the tonal language and messages in communication with volunteers. Partners entrusted by the city to manage resources must treat volunteers with dignity and respect. Let's keep in mind that volunteers are the city's greatest assets. Their commitment and dedication directly contribute to building a more responsive, inclusive, compassionate, and caring city for all to call home. Made possible the acquisition of 2 ergonomic chairs for each community center to address accommodation needs, address the digital gap to reduce the dangerous rate of social isolation and loneliness by offering live stream programs for older adults and people with disabilities, regardless of their living arrangement. Made the registration process for virtual programming easier and accessible. I bring to your attention the experience that could help us to do better for those we intend to serve and help. We should learn from those organizations that are leading and succeeding in keeping older adults and people with disabilities active and engaged. The work done by Dancing with Parkinson across Canada is impressive. This organization has facilitated the creation of a loving and caring virtual family across the nation. The American organization Senior Planet offers diverse activities all day from Monday to Friday and Saturday up to 2 p.m. Morning stretch at 10 a.m. welcome between 580 to 790 seniors. This organization works with volunteers as co-hosts. Senior Planet uses seniors from various cities, giving them opportunities to continue using their skills and abilities. Instructors teach from their homes. They share time with participants, fostering active socialization. Seniors daily talk, exchange ideas, and share information. I have been using the Save Link since I joined them 5 years ago. No renewals, programs are free of charge. In August, the Garden Studio hosted a summer bloom week that included about 2,000 seniors from more than 5 countries, including US, Canada, and Canada. The founder lives in Texas and is supported by a team of only 5 people located in the US, Canada, and Australia. This organization gives me hope, optimism, and strength of aging at home because their activities keep me active and engaged. COVID-19 taught us to be more caring, compassionate, loving, empathetic, and resilient, and left us the legacy of the use of technology to connect us with others. In closing, I read to brief quotes from a former executive director of the Good Companion Center, who was a panelist at the webinar Amplifying Impact of Community-Based Senior Service Sector in Eastern Ontario, hosted by United Way in early May 2025. We are not ready to meet the needs of the older adult population, and seniors deserve better. Thank you very much, Madam Chair.
Thank you very much. You have a question from Vice Chair Bradley.
Thank you, Chair. More of a comment than a question. I just wanted to thank you, Anna Maria, again, for all the work that you do in our community, and a particular thanks for the work that you do with New Beginnings. It was a pleasure to attend your Thanksgiving luncheon and to see some of the work that we've done together in action. I know it seems small, but the accessible chairs that we were able to get at the community center really enabled activities like that. And I know that there's still much more to do, and I look forward to continuing to work with you. So thank you.
Thank you, Councillor Bradley. I really appreciate your words. And as you say, it's a small, the actions of or the work done by New Beginnings is a small piece of the pie of the great contribution and the cultural seniors are doing across the city. We are serving over 3,000 seniors across the city. So thank you very much for your presence and the presence of the other city councillors. Thank you.
Wonderful. Thank you so much for your delegation. Our next delegation is Jonathan Rothschild from the Community Volunteer Income Tax Program. As Jonathan's coming up, I just want to let Andrea Poncia and Stephanie Fragman know that you are up in that order afterwards. So.
Oh, I see. Thank you. Thank you. I volunteer at 3 tax clinics in Ottawa, and I've done this for the past 7 years. I'm also the author of a bilingual website that tracks tax clinics across Canada. Today, I'm going to set the context for you. Since 1971, community tax clinics have been helping low-income Canadians file returns and access benefits. In 2024 alone, some 18,000 volunteers, like me, in 3,500 centers across Canada helped people to file almost 1 million returns. This unlocked more than $2 billion in direct benefits. A persistent concern is that many low-income individuals don't file returns, missing out on those benefits. In 2020, the federal government asked the Canada Revenue Agency, or CRA, to explore automatic tax filing. By 2024, the CRA had rebranded its earlier automated phone system as Simple File by Phone. 2 million people were invited to use it, but uptake has remained under 5%. For every person who used Simple File, more than 10 people relied on community tax clinics. The government now plans to introduce automatic tax filing in 2027. Although we don't yet know all the details, some elements have been made public. The CRA will mail pre-filled returns based on the income information it has. It will give recipients 90 days to respond. If they don't contact the CRA or file their own return by the deadline, the CRA will file their pre-filled return. By 2029, the CRA expects to issue up to 5.5 million pre-filled returns. This will help people with simple tax and benefit situations. but many people will still face challenges. Pre-filled returns won't include claims for expenditure-related benefits because the CRA doesn't have that information. Other problems include income errors, changes in marital status, changes in mailing address during the tax year. Where will people turn for help? They should be able to call the CRA, but the CRA struggles with call volumes, and it faces a $1 billion budget cut every year for the next 4 years. Even if a person gets through to an agent, getting past the client verification questions can be daunting. Most Canadians don't understand the tax system. That's why each year, some 60% ask other people to prepare and file their returns for them. Low-income Canadians are no different. Many will continue to seek help from community clinics to understand their returns or file them directly. Others won't qualify to receive pre-filled returns, including people who have not filed for the previous 2 years or more. Yet these are the very people that automatic filing is supposed to help. And the CRA will not prepare pre-filled returns for previous years. Yet I've helped clients file up to the last 10 years and collect thousands of dollars in refunds and benefits they were entitled to. I hope I've convinced you that community clinics will remain essential. Despite rising demand, CRA support is shrinking. A pilot project offering modest funding, about $3,000 per larger tax clinic, that started in 2021 ended earlier this year. No further funding was included in the latest federal budget. The CRA seems to be betting that automatic filing will reduce the demand for clinics. But demand will persist and likely grow. Council must continue supporting these clinics to protect vulnerable residents' income security. Even when financial support is available for community clinics, there's a second problem left unresolved. It's to do with indirect benefits. En tant que bénévole, mon travail consiste à préparer la
As
déclaration de
a
revenus.
volunteer, I'm helping people how to file their income tax and provide an explanation. Then I can have an overview of their financial safety nets. Sometimes they have rights to some benefits, but they forget to request them, such as the disability tax credit or those other tax credits. So sometimes the situation is very complex and clients need help. But I need someone that will be able to follow up with that person. So that's why we need workers that will work in poverty reduction. Personnel that will be helping these users to access all the benefits they have the right to.
Thank you. You have a question from Councillor Troster.
Hi, thank you so much for being here. We see so many people facing evictions in my ward, specifically because they haven't done their taxes. Because something that a lot of people don't realize is that if you're in receipt of a housing subsidy and if you fall back on your taxes, at some point that subsidy is going to be taken away. And there's a lot of residents who don't even realize it's been taken away. So then they end up in arrears, sometimes by multiple years. So by the time they're facing an eviction and they come to my office, they might be $40,000 in arrears and not even know why. So I want to thank you so much for the valuable work that you do. I was really hopeful when I heard about the federal announcement about automatic filing, but I'm really interested to hear your criticism. I would really love it if you could follow up with my office, because I think if there's advocacy that we should be doing as a city for how the feds might be able to improve that program so that we don't have to rely as much on community clinics, that would be really great. So I hear some of your recommendations around people who haven't filed for 2 years, people who might have other income sources. Although I will say, I am hopeful that folks who their only source of income is government assistance, that the filing would be done for them. Is there anything else you wanted to say about what's missing from the CRA's approach other than the funding gap too?
Simply that I think our expectations are much higher than what the reality will deliver. I gave the example of Simple File, which actually started in 2018 under a different name and has never actually exceeded 5% of adoption rate. And so even though the federal government is talking about ramping up between 2027 to 2029 on the number of pre-filled returns that it mails out, I think it's going to struggle for much longer than the next 3 years to actually get it right. And so while in the long term, we would all love to have an automatic tax filing system that reduces the burden on us, I think our expectations should be quite low for what we're going to be able to achieve in the next 5 years or so.
Thank you so much. The kind of work that volunteers do at these tax clinics and the community health centers and all the different community organizations that put them on. I mean, it brings millions and millions of dollars back into our economy, and it also helps people restore their housing and put food on the table. So thank you so much.
Thank you.
Thank you, Counselor. Counselor King.
Thank you, Chair. And I just wanted to quickly echo the comments of Councillor Troster and thank all the community organizations, including community resource centers. I know that the resource center in my ward, the Rideau Rockcliffe Community Resource Center, does a lot of work in terms of helping lower income families file their taxes so that they can have more revenue, which really translates into more resources for those families. I really also want to thank you for your advocacy. I think it's important to consider that whether you're a middle income Canadian or a higher income Canadian, often you will take advantage of tax specialists in order to undertake your filing. We shouldn't expect any different in terms of lower income Canadians. They should be able to access resources so that they can also undertake their tax filings in expedited and in an efficient manner. So I'm really thankful for the work that your organization, other organizations do on this file. I know that this might move away from our budget, but I'm hoping, of course, that you will be advocating in front of the federal government with your concerns. And I'm just curious if you could just briefly inform us if you know what that process will look like in terms of delegations before Parliament to really relay these concerns to the federal government.
In a nutshell, I don't. What I do know is that between now and 2027, in other words, primarily the 2026 tax season, we're going to see CRA start to experiment with this new authority that it's been given to issue some pre-filled returns, and in the case where individuals don't respond, actually file them on their behalf. And we'll see what problems may arise from that. At the same time, the CRA has committed to a consultation process, which it actually started in 2024, I believe, on the next steps towards what I've described a moment ago. But at this point in time, beyond consultations and experimentation, I'm not aware specifically of what the CRA is going to be doing.
Well, I'm definitely appreciative of all the efforts of your organization and multiple organizations. We hope that they do continue because we see the challenges that can emerge. Imagine waiting for tax filing documents in the mail when we have a strike, or imagine trying to call a CRA for advice and staying on the phone for hours and hours and hours on end. So I think that the services that are being provided by your organization and other organizations are really key and are fundamental. And, please also reach out to my office around advocacy so that we can continue to support those efforts. Thank you, Chair.
Thank you.
Thank you very much, Counselor. Thank you for your delegation. I'll invite Andrea Poncia from the Coalition of Community Health and Resource Centers to come speak. Yep, that's okay.
Hello.
Hi, thank you for being here.
Thank you, Chair and the committee, members of the committee, for the opportunity to speak to you today. I'm here to propose a way the city could help residents living in poverty access unclaimed federal and provincial funding by expanding community tax clinics at social service organizations across Ottawa. We believe that every conversation we have about helping people in need should start with, did you file a tax return? Setting aside Ontario Works or ODSP, there are no better programs at reducing poverty than this Ontario tax or than these social service tax clinics. And yet these clinics have no core funding and are set up on the sides of desks of social service organizations. This results in a limited capacity and an inability to meet community needs. And sadly, it results in turning people away, even this year where we did have some success in additional supports. And sadly, this will not change with automatic filing. Community tax clinics will remain essential for low-income residents, newcomers, and seniors now and in the future, even with automatic filing on the horizon. People will continue to face complex situations, missing documents, language barriers, or lack of awareness that prevent them from benefiting from automatic tax filing. We applaud the city for providing a small amount of funding in last year's budget to help us build that infrastructure. The investment strengthened our effectiveness and allowed us to reach more people. And we are grateful to see that that funding is being suggested to be renewed this year. So we're thankful for that. Last year, the CHRC saw a 33% increase in the number of returns completed. We helped 3,486 individuals file taxes, accessing on average of 5,350 in annual federal and provincial benefits for a total of 18 million that went back into the pockets of low-income residents. So that's just the CHRCs last year. So that was an increase. The proof of concept worked. There was a small investment, and we demonstrated that we could reach more people. The city made a down payment last year, and we urge you this year to go beyond funding the coordination and really fund the delivery of those services so that we can really make a big impact. Our ask is scalable, whether as a $3 million investment to hire 22 poverty reduction workers or a smaller pilot would allow us to demonstrate the strong impact of the social service tax clinic. Poverty reduction workers would support the many residents in Ottawa who face barriers to filing. A typical return takes 30 minutes, but CHRCs find that people with complex needs require additional support to navigate systems, assemble documents, overcome language barriers, and manage follow-ups. Poverty reduction workers are essential to support residents through this complexity. The decline of CRA funding for the CVITP program and the ongoing large scale of unmet needs put the entire community tax system at risk. And then we'll hear more about that through other deputations. Municipalities have limited influence over provincial programs. While we cannot control the amount of income people receive from programs like Ontario Works, we can strengthen the pathways that help residents access the benefits that do exist. By funding poverty reduction workers, the city enables us to find isolated residents, build relationships, and support them to file their taxes so that they can receive the benefits they're entitled to. This is important because it's the municipality that pays when residents cannot access their benefits. Municipal housing, policing, and food security services bear the downstream costs. Community tax clinics have a significant impact on local communities when cash transfers are overwhelmingly spent locally, creating a multiplier effect for small businesses. We urge the city to invest in these proactive services and lean into the areas where it can have an impact, especially now when residents are so urgently in need of federal and provincial dollars to make ends meet. Social service tax clinics are our best tool to prevent avoidable crises that ultimately place greater strain on municipal services.
Thank you very much, Andrea. You have a question from Councillor Troster.
Hi, Andrea. Thanks for being here. So last year, you all came out in great numbers to advocate for greater funding for low-income tax clinics. I know there was a little bit of an increase, and you said that that was a down payment that was really helpful. So what are you seeking this year, understanding that by the time this budget comes to committee, it is kind of difficult to make changes. But I know one of the arguments last year was this is something that the feds should be doing, the CRA should be doing this. And it's an additional burden that the city would be getting on, but you had a cost benefit analysis last year that was really helpful. Do you have a sense of those figures? It was like, if we invest X dollars, it could bring X million dollars.
Yes, it would be the same. It was an investment of $3 million would bring a return on investment of 72 million. So
72 million.
Yeah, the numbers would be the same. Because we're still counting on people not being able to access the automatic filing. We're still counting on people needing to access those benefits. And, those benefits are especially for people that we support, the medical expenses for senior citizens. Another example would be if someone was separated during the tax year, the automatic filing wouldn't work for them. They would have to go back and refile. All of that support is the kind of work that we would be doing. And, you know, we're saying that a scalable ask, what we're asking for is to continue to support the coordination because that did have an impact and it continues to have an impact. But we're saying to also fund some services so that there could be workers out there really engaging people because that wasn't part of the previous investments. So that's what we're encouraging.
Okay, and you're asking for the city to fund more poverty reduction workers. So in addition to helping folks fill those claims, what else are those workers doing to help?
They would
reduce poverty?
also, so they would be also helping people with many different financial benefits. So it would not only be with taxes. So currently, if you go into a CHRC, so for example, Orleans Cumberland Community Resource Center, they spend 2 full days of their crisis intake services only helping people fill out LEAP and OESP applications. Those are 2 different types of benefits that people can access. So that means that for those 2 full days, they're not able to support with many other crises that we're usually supporting with. So these workers would also help with LEAP and OESP, and they would have a big role in doing engagement, finding those residents who are very skeptical. For example, newcomers, there's a lot of, we heard last year in our deputation, there's a lot of myths in the newcomer community about you don't have to file, you know, or if you do file, you'll have to start paying, these sorts of things. And so people are missing out on benefits. These people really need the benefits of, imagine childcare, child tax benefits, and et cetera. So we would be doing education, letting people know that these benefits exist for them and quashing myths about not doing their taxes and just reaching people who are very marginalized. Like in Somerset, if you think of in your ward, councillor, there's a lot of those people who don't realize that they need to do their taxes. They're, you know, people who are unstably housed and who are using substances, you know, they also are entitled to all of those benefits that would really support them to maintain or gain some stability. So finding those people and engaging them, supporting them, building relationships with them would be this type of thing.
Yeah, Robin Lennox, who's an MPP in Hamilton, recently posted that there was a resident who went to one of their low-income tax clinics, a single mom with multiple kids who hadn't filed their taxes for 2-3 years. And the money she was able to get back after filing was in the hundreds of thousands.
Oh, yeah.
Like it was just like an absurd return that had not been due to her. So anyway, thank you. And I agree with you. I think this is one of these situations where if we don't act, it's more financial burden on the city if people end up in shelter, but it's also another scenario where we shouldn't have to, but here we are.
Exactly.
Right? Yeah.
Indeed, it would be ideal if the federal government could do this, but with what they're proposing, it's not going to be the solution that we're hoping for, as Jonathan said, for the residents that we're supporting.
Okay.
Oh,
Anyway, I really appreciate it. Yeah.
Jonathan.
May I just add 1 or 2 points? First of all, we call it doing your taxes, okay? The Canada Revenue Agency calls it doing your income tax and benefit return. Most of our clients are not paying taxes.
Yeah.
But it is crucial to file to get the benefits. So in part, it's a marketing problem. We talk about doing your taxes. Oh, I don't have any taxes to pay, so I don't need to file a return. Not true. Let me give you examples of indirect benefits. These don't come from filing your return, but if you haven't filed your return, you will not be able to get these benefits. And in most cases, you need to do all the work for applying for these online. Many of our clients, they don't have access. They don't know how to use computers. So mentioned Canada Child Benefits, Canada Learning Bond, the RASP, Registered Education Savings Plan for low-income families. The Disability Tax Credit Certificate, which most of our clients who are on ODSP never got because it didn't help you reduce your taxes, or sorry, it helps you reduce your taxes, but if you're not paying taxes to begin with, it doesn't make a difference. But now it does. You have to have the Disability Tax Credit Certificate if you want to apply for the Canada Disability Benefit, which can give you up to $2,400 a year tax-free. Okay.
So Mr. Rothschild, I apologize, but because you had your opportunity to delegate, answer questions, and you are here merely for anything that Andrea can't answer, I'm going to cut you off. Andrea, if there's anything else you want to add very quickly, but you do have another question waiting for you.
Oh, yeah. Okay. I'm done for this one. Yeah.
Okay. Thank you. I just want to keep the conversation. And I think we have at least 2 other people who want to speak on the same subject. So we're going to keep this ball rolling. Councillor Troster, did you have any other questions?
No, I just want to thank you for all your work. I appreciate your advocacy.
Thank you very much. Councillor Kavanaugh.
Yes, thank you, Chair. And thank you for all your work. I realize how valuable it is. My question is, I'm just curious, I assume this, but do you coordinate with Ottawa Community Housing? Because I know that they
Yes.
do outreach as well.
Absolutely.
And they're
And this is a big implication for OCH. And so I spoke yesterday with some OCH team members about the automatic filing, and they are also like their eyes are widening, thinking, oh man, this is going to be a lot of work for them to support people to go back and fix when there's an issue, or, to make sure that people's, are aware of this change. And so OCH no longer does their own taxes, but they partner with us and with people in our network. So EBO will go in and do taxes. And so we're, thanks again to the funding from the city, we were even more coordinated than we already were. So we're working together as a system of community tax services. And so, yes, we are absolutely working with OCH.
excellent. Yeah, thank you. Just wanted to.
Very important demographic of people to work with. 'Cause
Yes.
They need their taxes to get that.
Yes, and
Subsidy.
I'm convinced we'll continue that partnership. Thank you so much.
Yeah.
Thank you so much, Councillor Kavanaugh. Thank you both for being here and thank you for your delegation. Stephanie Fragman from the Eastern Ontario Community Resource Centre is up. Following Stephanie, we'll have Valens N and then Marc d'Orangeville. So just so you're on deck, folks. Stephanie, welcome. Thanks for being here.
Good morning. Thank you very much for having me, Executive Director of the Eastern Ottawa Resource Centre, as well as a member of the Financial Security Pillar Working Group. You've just heard why community tax clinics remain essential, even with automatic tax filing on the horizon. I'd like to share what this looks like for the people who walk through our doors. So at the ORC, we have a very small tax clinic with no dedicated budget. In 2024, we completed 125 returns. In 2025, thanks to the city's $150,000 investment in tax clinic coordination, of which ORC received only $7,500, we were able to double our capacity, completing 260 returns. And almost all CHRC clinics that received the same small amount saw similar gains. So it's a tiny investment with really a massive impact. It shows how investing in multi-service centers like the CHRCs amplifies impact. Small contributions come together to drive big results. ERC's clinic is one of the smallest of the CHRCs, yet the return on investment is enormous because every tax return unlocks benefits, as we've mentioned, federal, provincial, disability-related, child benefits, etc. But something even more important happens during those appointments. We listen to people's stories and connect them with the services they need to meet their basic needs. For example, a mother came to our clinic this spring with her 8-year-old autistic son. She expected a routine tax filing. But during that appointment, our volunteer asked her, have you ever applied for the disability tax credit? And she hadn't. No one had ever told her that she could. We explained that she could qualify even retroactively along with the child disability benefit, and then this could mean thousands of dollars to support her son's care. Her eyes had filled with tears at that moment, but not because of the money, but simply because someone had opened a door that she didn't even know existed. This is what accessible, resourced community tax clinics do. They don't just file returns, they change futures. Another woman, 72 years old, lives on a modest pension. Every year, she relies on the free tax clinic to help her file. But this year, appointments filled up before she could get one, and she thought she could wait a few weeks. But that delay meant a small tax balance with interest, money she did not have. And even worse, her guaranteed income supplement was suspended because her income information wasn't updated in time. For 3 months, she lived without that income and relied on her tiny food cupboard to survive. A small gap like this can become a crisis overnight. These stories are not exceptional. They are daily. We see them all the time. Every tax appointment reveals other needs: food insecurity, unsafe housing, untreated mental health struggles. Yet our food cupboard receives no funding either, even as food banks across the city have seen increases. Our particular food cupboard is not eligible for those funds, but our community's hunger doesn't shrink because we aren't funded. Our large catchment area includes underserved neighborhoods like Sawmill Creek, Blossom Park, Finley Creek. We cover Councillor Bradley's ward, Councillor Dudas's ward as well. But we can only help those who can reach our Gloucester site. We currently don't have the capacity to go to them, so our entire communities within our catchment have little access to tax help or to the supports that follow. Our staff are skilled and compassionate, but growing complex needs are causing burnouts. Automatic tax filing will not fix this. It will not detect, as previous speakers have said, it won't detect incorrect income, marital status changes, or past year returns, nor help people apply for benefits unlocked by their tax returns. This is why we urgently need poverty reduction workers to help residents access benefits, to navigate complex systems like dental care, disability supports, and OESP, and provide wraparound services addressing root causes of poverty. This is how you lift people out of poverty meaningfully and sustainably. Chair, members of the committee, we have the trust of the community, the reach and the skills, but we are not able to meet all the service. We weren't able to meet all the service needs last year. We're grateful that the city gave us that initial funding to enhance coordination and develop a proof of concept. Now we need investment in services to meet growing demand and prevent crises. As Andrea mentioned, many people living in poverty still aren't filing taxes, and limited funding restricts our reach. With CRA ending VITP funding in 2026, this service is at risk. I urge the city to invest $3 million in poverty reduction workers. This is a scalable ask. It could be a pilot project, so people can access the income they're entitled to and no federal or provincial funding goes unclaimed. Thank you for your time and your commitment to strengthening financial security for Ottawa residents.
Thank you very much, Stephanie. I'm not seeing any questions for you, but thank you for the work that you do, the Resource Center does in our community. I know my community personally benefits immensely from it. And thank you for your delegation. It bodes well for, it ties in well with the ones that were previous.
Thank you so much.
I'd like to invite the next delegation, Valens N, Community Volunteer Income Tax Program.
Thank you, Chair, and the members of the committee for the opportunity to speak with you today. My name is Valens Nitejeka, and I was a volunteer income tax preparer with the community, with the CVITP at the Ridoro Cliff Community Resource Center during this tax year season. I'm here today to speak about the critical importance of community tax clinics, and I would like to begin with my own experience as a newcomer. As a newcomer to Canada with a professional background in accounting, finance, audit, and taxation, I thought I understood taxes. But when I arrived from Rwanda, I quickly learned that the system were completely different. In my home country, only individual business owners file taxes. Employees and other non-business individuals do not. So when my family first landed in Canada last year, June, while trying to find housing, childcare, schools, and a sense of stability, I had no idea that filing a personal income tax was even required. I was focused on settling, surviving day-to-day, understanding a new country. Taxes were not on my list of priorities. My wife was pregnant at the time with our youngest child. Everything changed when our midwife referred us to the Ridoro Cliff Community Resource Center. It was there I finally understood what people meant when they said connect with the community. The community helped me learn that I have to file my taxes, showed me how the system worked, and guided me through every step. Without that human support, I would not have known that benefit I was entitled to or how to assess them. Because of that, I joined the CIVTP as a volunteer income tax preparer. I helped the low-income residents, newcomers, seniors, people with experiencing homelessness file their taxes free of charge. Most of our volunteers were newcomers themselves, and together we worked tirelessly across 9 communities, community locations to meet people where they were. During the tax year, we was able to complete more than 1,000 income tax returns. But what made me work truly meaningful was the stories behind each appointment. One newcomer mother arrived with no document at all. She said, I know I have to file taxes, but I don't know where to start. She did not understand the serial forms or slips, and she left embarrassed. We took the time to explain what she needed, helped her gather the right document, and filed the returns. She left with visible relief and came back weeks later just to thank us. Another senior told me, this is the first time someone helped me understand what I'm signing. For many residents, tax filing is not just a financial obligation. It's a barrier that prevents them from accessing the basic support they rely on. The Laurier Cliff Community Resource Center made this possible by providing training, equipment, coordination, and a strong community partnership. They brought the service into 9 neighborhoods so that people who could not travel, like seniors and the single parents, could still access support close to home. And this program didn't only strengthen residents, it also strengthened volunteers. It helped newcomers like me integrate, build confidence, gain Canadian experience, and feel part of the city we now call home. This is why tax clinics matter. They are essential, not optional, and they will continue to be needed, even with automatic tax filing, because technology cannot replace human guidance, cultural understanding, or ability to sit with someone who feels overwhelmed and walk them through a system they do not yet understand. The Community Volunteer Income Tax Program was and continues to be an essential service that strengthens both individuals and the communities. Thank you for your time and for your continued commitment to a stronger, more inclusive Ottawa.
Thank you so much for your presentation. You have a question from Councillor King.
Thank you so much, Chair. And it's not a question as much as a comment. I really just wanted to thank you for sharing your story, your personal story, as well as for your contribution to the Rideau Rockcliffe Community Resource Center in terms of tax preparation. I think it's an amazing story to hear about a newcomer coming to this country, learning about the process, and then in turn contributing. And I think it's also very powerful because, as we know, the Resource Center in Rideau Rockcliffe operates out of the Rideau Community Hub, and there are 30 plus organizations in there, including newcomer settlement organizations. So the synergies are very powerful. The fact that somebody from CISOC at the hub who might need tax filing services can access them in the center, in the same hub. So I think those synergies are very powerful. And I really just wanted to thank you for once again sharing your story and sharing your expertise with our community.
Thank you very much.
Chair.
Thank you, Councillor. Thank you very much for being here today.
Okay, thank you.
I would now invite Marc Drangeville, Centre de définition financière en totale budgétaire d'Ottawa. Well, sorry, my hearing, I'm old and my hearing is poor. What? Is there a translation? Oui, absolument. Pour nous, avec le, so if you speak in French, we'll understand. No problem.
Yeah.
Also, tu es une non, non, je m'excuse, pardon.
Merci.
Proceed.
Thank you. Good morning, and thank you for allowing me to speak. I am Marc D'Argeville, General Director of the Financial Education Center, EBO. I'm here to thank you for the $150,000 that you gave us and to present you a summary of what we did with it. This project started in the middle of the income tax season this year, and despite it all, we work with the coalition of health centers and community resources centers to show what's possible in terms of data collection and service providing with these funds. So EBO and the coalition presented some 40% of all declarations made in 2024 through the community program of the Community Volunteer Income Tax Program. In 2025, this represented 6,335 declarations and many, many benefits and credits obtained by our clients. Thanks to an investment of $60,000 for the Health and Community Resources Centers, 7 of them increased their number of declarations and of about 23%. So that represents about $3 million, especially thanks to some surveys made with our clients that were late in May. For the first time, we have information on the fact that 15% of these clients were filing for the first time, and 50% are receiving other community services on top of the tax filing. And on top of being low income, 34 people are part of a priority group.
The second phase of the project, EBO focused on building sustainable infrastructure for future tax season. So EBO consulted extensively and repeatedly with all tax clinics in the city of Ottawa about their needs and best practices. So the project invested $40,000 in 3 tools. The first one, an online navigation tool to help low-income individuals find the best clinic for their location, for their tax situation, but also a tax clinic with available appointment. We also invested in an online booking system, which will be accessible to all clinics that wish to use it to save time for taking appointment, but also with automatic reminders to clients because we know that no-show is a problem in tax clinics. And finally, a dashboard currently under development for the 2026 tax season for centralized data collection, combining both city evaluation surveys and anonymized tax information. So essential to this project, we are also finalizing training for all new volunteers in January and February 2026, which EBO will be able to provide in place of the clinics, again, to save them time, but also to improve practices. So there is real positive momentum around the coordination of tax clinics because it improves the efficiency of tax clinics and their impact. I trust that you will follow the advice of the Office of Community Safety and Wellbeing to renew funding for this coordination in order to enable the development of all aspects that have been identified as important in the future, such as mapping service gaps through better data collection and creating missing services, such as those for low income who are self-employed. However, I would also like to point out that coordinations depends above all on having participants to coordinate. Unfortunately, tax clinics are unfunded services. The organization offering these clinics are under multiple pressures to deliver numerous services, and many, I heard many, considering how to reduce the size of their tax clinic in order to better focus on services for which they are funded. So that is why I personally encourage you to give serious consideration to the coalition proposal for funding poverty reduction workers. With the coordination of tax clinics, these workers will really make it possible to reach the 20% of low-income individuals who are not yet receiving the benefits that they are entitled to. Thank you for your attention.
Merci, Marc, pour votre présentation aujourd'hui.
Thank you for your presentation today.
Seen any questions for you? Thank you very much for being here. Merci beaucoup.
Thank you.
I'd like to invite Robin Brown from 613-819 Black Hub. After Robin speaks, we'll then have Aline Leo from the Ottawa Mission and David Hole from the Ottawa Neighborhood Solutions. Robin, welcome. You have 5 minutes.
Thank you, Chair. Okay. The city's website says that this committee is responsible for creating and maintaining a safe and healthy community that promotes and supports quality of life and is responsible for issues relating to housing, parks, recreation, museums, and heritage programming, long-term care, and social services. So I'm here to convince some of you to recommend against the draft budget because it contains far too little funding for all those things and because the overall budget contains way too much money for the police. I have delegated at Ottawa Police Service Board meetings almost every month for the last 4.5 years, and I always end my delegations the same way, by saying it's time to reimagine community safety by shifting money away from the Ottawa Police to things that actually respect people's human rights and keep us all safer. So I'd like to highlight for you what could be done if even a small portion of the Ottawa Police's more than $400 million budget was invested in the kinds of things this committee is responsible for. Now, the OPS wants $600 million for body cameras, more than $11 million to implement the new district model, and as always, more than $500,000 for dry cleaning. That's a total of about $12 million. So what could be done with $12 million? $12 million could provide an annual permanent and supportive, or provide annual and permanent and supportive housing for 300 people. $12 million could provide an annual rent supplement for 2,000 people. $12 million could enable over 600 people to pay annual daycare costs, or $12 million could provide 80 times the $150,000 in the budget for community tax clinics, which we've heard from the previous delegates are so important. You could take the first step towards enabling such investments by voting against the largest police budget increase in 15 years, especially given that City Council's four stated priorities. Your stated priorities are: 1, a city that has affordable housing and is livable for all; 2, a city that is more connected with reliable, safe, and accessible mobility options; 3, a city that is green and resilient; and 4, a city with a diversified and prosperous economy. A city with more police isn't one of City Council's four priorities. So we call on you to follow your own priorities and recommend against the proposed CSC budget and to vote against the police budget when the time comes. Now, obviously, I'm appealing to those of you who haven't decided how you'll vote yet, and those who might be open to changing your minds. Now, that doesn't include Councillor Hill. Councillor Hill has made his position crystal clear by delegating at police board meetings several times in favor of increases to the police. So I think every Ottawa resident, including or especially his constituents, deserve an answer to this question. Councillor Hill, does your call for more police include more police? Yes.
I'm going to pull you back. You've kept it in the realm of CSC committee and budget. You're now asking specifically one member to comment on police budget.
I don't need a comment.
So what I'm asking is for you to stick within CSC. If you want to link it in some ways, I understand that. I'm accepting of it. Stay within the realm of it at this budget at this time. Okay? Sound good?
This is absolutely within the budget. Absolutely. And the question is, Councillor Hill, does your call for more police include more police to enforce the electoral laws you were caught breaking during the last election?
All right,
when you were
we've
seeing
this. We're going to cut this off now. You're talking about budget about a different committee, actually a board that is arm's length from City of Ottawa. You're referring to a colleague of ours in respect to comments that I don't know where the heck that's going. So I'm going to give you one more chance. If you wish to speak about the CSC budget, refer to that. If you want to base it on your feelings about the police, you're welcome to it. But I am not going to entertain this kind of questioning or comments. Sound good?
Sure. Now, some people say that you can't move money from the police budget to other things. And by some people, I mean Ottawa's general manager and chief financial officer and former chief financial officer of the Ottawa Police, Cyril Rogers, who I've heard say this 3 times in the last 2 years. But it's not true, because you can move money from the police budget to other things, because that's what happened in 2021. Due to public pressure and the leadership of Councillor Ralston King, and I'll see you tonight, Ralston, in your budget consultation, and the late Diane Deans, $2.65 million of the police budget was shifted to youth and mental health programs. So we call on you to reimagine community safety by shifting money away from the Ottawa Police to things that actually respect people's human rights and keep us all safer. Thank you.
And I thank you for pulling that back. Okay, does anyone have any questions for Mr. Brown? Councillor Brockington.
Thank you, Madam Chair, and thank you, Mr. Brown, for your delegation. If this committee was able to get additional funding to allocate to the department's various priorities, what are your top 1 or 2 priorities? I think I heard you earlier say if there was $12 million freed up from the OPS, here are some examples. Are those your top priorities? Maybe they were just examples. If we had the opportunity to add additional funding for this particular committee's budget, where should it be directed?
No, thank you for that question. I think so. So on this committee, it mentions housing. I'm not sure what So that without a doubt, housing is it.
Okay.
The number one thing to shift money to would be housing. So whatever the element of housing that this committee covers, that would be it. Absolutely. In fact, I've decided to move part of the hub's work from policing to housing for that exact reason.
Fair enough. That's helpful. Thank you very much.
No problem.
Okay, seeing no further questions, thank you for being here. Aline Leo from the Ottawa Mission. Thank you so much for being here. And you have 5 minutes whenever you wish to start.
Good morning, councillors. On behalf of the Ottawa Mission, thank you for the opportunity to speak to you today about the City of Ottawa's 2026 draft budget. As our CEO, Peter Tilley, noted earlier to this committee, we applaud the City of Ottawa for its newcomer reception centres, which have partially eased overcapacity issues at our shelter. We also applaud the new Bumblebee initiative, supportive housing development at 811 Gladstone, which is desperately needed. Peter has also expressed his concern to the Planning and Housing Committee about the fact that while there has been a nominal increase to the capital budget for new affordable and supportive housing within the 2026 budget, it is still below the 30 million within the 2023 City of Ottawa budget. He urged that committee to return to the level of 30 million set 2 years ago for affordable and supportive housing units. So I'll confine my remarks here to 2 other items within the budget that have a direct bearing on this committee. Number 1, the Anchor Program, and number 2, food security. The mission is very pleased that the Anchor Program is expanding to include a larger area of Centretown, which is my neighborhood, as well as another area of the city. We urge the city to further expand this program to respond to the mental health needs of increasing numbers of very vulnerable people. The fact that this program has responded to more than 400 or 4,000 calls since it was introduced in August 2024 is ample evidence of its need within Centretown and beyond. The budget has allocated $476,000 to food security. Well, this is a 15% increase from last year, out of a total $5.2 billion operating budget for the city. Unfortunately, this is far below what is needed to meaningfully address food insecurity, given that Ottawa Public Health has confirmed that 25.7% of households in our community are now food insecure, up from 16.3% in 2019. Earlier this month, I attended the release of the Ottawa Food Bank's annual hunger report, which showed that the OFB's member agencies, we are one of those agencies, had 866,000 visits over the past year, which is a 101% increase over visits in 2019. These figures are very sobering. Similarly, the Mission's food truck program has grown from 5 stops and 500 meals per week in 2020 to now 41 stops, serving a jaw-dropping 11,500 meals per week. In our last fiscal year, it served almost 600,000 meals across the city. This is one reason why our shelter has served over 1 million meals across Ottawa for the past 3 years. Last year, we served over 1.2 million meals, a 244% increase from 2019. Many of these stops are adjacent to Ottawa community housing buildings, and these clients are also clients of the food truck program, without which they would go hungry, since most community food banks can only provide 3 days' supply or worth of food once a month. Several clients at these stops have expressed their gratitude to the City of Ottawa for supplying the food trucks, and are surprised when they learn that, in fact, the Ottawa Mission is responsible for the program, which is paid for entirely by our donors. Food security is a pillar of the city's poverty reduction strategy. Our food truck program, which serves healthy food at so many stops across the city, goes a long way toward curbing food insecurity in Ottawa. This program now costs our shelter almost $900,000 a year. For counselors with food truck stops in their ward, imagine the impact if the mission was no longer able to run this program. In the wake of the pandemic, increased mental health distress, substance use, and other challenges, our shelter's ability to meet the needs of vulnerable people is now stretched to the limit. Whereas 10 years ago, our fundraising was evenly matched by funding from the City of Ottawa, now our fundraising efforts comprise 58% of our total budget, while the City of Ottawa comprises 23%. And don't get me wrong, we're very grateful for the support of the City of Ottawa, but as the needs keep increasing, so do the need for funds to run those programs. So thank you very much for your attention, and I'd be very pleased to answer any questions you may have.
Thank you so much, Eileen. And you do have a question from Councillor Troster.
Hi, Aileen. Thank you so much for being here. I don't know if you know, but last week there was a small demonstration near City Hall of folks who wanted to know what the city's winter plan was. And there's some concern that since we have closed the physical distancing centers, which ultimately was a good thing to return those shelters to those community centers back to the community, and focus on transitional housing and our strategy, which has certainly alleviated the issue of newcomers in your shelter. There's some concern that people sort of don't know where to send people or where they go. On a night-by-night basis, do you consider the mission to be full, or is there still room if someone shows up?
We have been full for almost 8 years at over 100% capacity. This is a long-standing problem. The only time that we dropped below 100% capacity was during the pandemic, and we closed approximately 60 shelter beds to divert clients to overflow shelters. And that was enormously helpful. But now that those centers have closed, we have now returned back to over 100% capacity, which is unfortunate. So yes, the transitional housing strategy has alleviated those overcapacity problems. But I can tell you now that cold weather has returned. We are seeing, instead of about 12 people per night sleeping on chairs in our lounge, we're seeing 20, 30, 40 people per night. So is this a routing problem between places for vulnerable people to go? I'm not sure how to answer that question, but I can tell you at our own shelter, we still have people always sleeping on mats in our lounge, and we still unfortunately have people sleeping either on chairs in our lounge or on the floor in our lounge. None of that is desirable.
Thank you for letting us know about that. And on a night where even your lounge is full, where do you send people if they show up and they're cold and have nowhere to go?
We try very hard not to turn people away. In the past, we've had to do that. Unfortunately, what we do is we call around to other shelters to see if there are spaces there. But as I'm sure you probably know, most, if not all, shelters on a continuous basis are full. So we divert clients to other places like Center 507, which now has people staying overnight. We know that other day programs are now contemplating that because, of course, homelessness is at record levels, and also people who are homelessness and street involved, i.e. people sleeping on the street, which obviously we don't want, is also at a record high. So we try very hard to divert these clients to somewhere safe. We also urge clients to call 311 so they can receive direction from the city as to what spaces might be available.
Thank you. So yeah, generally what we're hearing is in cases of extreme cold, people can call 311 to access a shelter space for themselves or for someone in their community. I'm interested in hearing, have you heard from your clients from a user perspective how that's working? So if someone is cold or if they find someone on the street and they call 311, are they getting people to where they need to go? Because we're getting a lot of questions about these concepts of warming centers, which is not something that's ever really existed in Ottawa. We've always said, go through the front door of 311 and you will absolutely find a place. I'm just wondering on the ground how that's working for people from your perspective.
I haven't had a recent conversation with frontline staff. I have talked to the manager of frontline services incidentally in the past. We do direct people to call 311 Sometimes clients don't get direct service for whatever reason. I'm not going to speculate on that. But if you're asking me, are people immediately diverted to a safe place if they call 311? I would have to say not all the time, unfortunately.
And so with the closure of the physical distancing centers and now this new model where we've invested in transitional housing instead, like, do you think there's a need that's currently not being met? Is there something else you think the city should be doing differently, particularly during the really cold months?
Well, I think what we all want to avoid is what happened last January, where 2 people incurred terrible exposure and then later died. Nobody wants that. In terms of capacity issues, I would say that there is certainly capacity that is unmet for shelter beds. How that is met, I would leave that to the city to decide, basically. But yes, if you're asking if there's still an unmet need, the answer is yes.
Thank you very much.
Thank you, Councillor Troster. Councillor Kavanaugh.
Yeah, thank you, Chair. And thanks, Celine, for bringing this information to us. I just want to point out, and you've mentioned about the food truck, that it's not just a downtown thing. I have 4 locations in Bay Ward, where the food truck is coming, and it's a lifeline. So it really indicates the food insecurity problem, and it's much appreciated. I don't think we could have invented it. It just happened during the pandemic, and it's like it can't go away. So.
Well, you're absolutely right, Councillor Kavanaugh. The food truck program was the brainchild of Chef Rick, who's the Director of Food Services at the Ottawa Mission. He was able to access a used food truck from the Pelican Grill. We'll always be eternally grateful to Jim Foster of the Pelican Grill. That was initially conceived as a pandemic response only because a number of community food banks, emergency food cupboards were closed during the pandemic. We ourselves had to divert our community meal program clients who used to come into the dining room of our shelter. So we had to divert them to our garage, where we serve them 1 hot and 2 cold meals along with a small bag of groceries. So again, just because of the shocking need for food in our community, it's been exacerbated by terrible food inflation, which has abated but not gone away. We are now looking at catastrophic rates of food insecurity, and one reason why this program has expanded continuously, it's grown 8-fold in the last 5 years. It is dreadful to see people go hungry. I've seen people come up to the food truck and before we reopened our shelter, literally grab bags of meals, tear them open and eat the meals with their hands. That's how hungry they are. I've seen people bring their children to food truck lines. I've seen people come in walkers, in wheelchairs. That's not acceptable in a reasonably prosperous city like Ottawa. So this is why we continue to do this, but it is at a cost to us.
Thank you very much. Those illustrations, I think, really prove that hunger report, the reality. Thank you.
Thank you.
Councillor King.
Thank you, Chair. And I also want to echo my colleagues in thanking the mission for the work that they're doing in the community. I know that many residents in Rideau Rockcliffe are beneficiaries of the services that you provide. I know that the truck is mobile in my ward, and that's very important. I know, building off Councillor Kavanaugh's line of questioning, in terms of one of the responses you had, you talked about inflation. I was wondering if you could speak, obviously that's impacting the low income families who can't afford food, but that's obviously also impacting the network of food providers in the city. And I'm just wondering if you could briefly talk about the impact of food inflation on the mission and other organizations.
Yes, thank you, Councillor King, for the question. That's actually extremely important because whereas I would say for the first 18 months, 2 years of this program, it was almost exclusively for low-income people, but now we have people coming to our food trucks who are actually employed. Many of them are employed at lower-paying jobs. Certainly, almost all of the clients of the food truck at one point were on OW or ODSP. But many clients are working. Many clients are seniors. The CBC's, the National, did a documentary on the food truck about 3 years ago. And the title of the report was called Inflation Frontline, Who Needs a Free Meal? It talked about seniors, it talked about low-wage workers, it talked about people who are underemployed, but it also talked about people who are struggling with record levels of rent in our community because, you know, the old saying, pay the rent or feed your kids. Many clients who come to the food truck are caught in that dilemma. So it's not just people who are on social assistance, not just people who happen to be underemployed. It's people who are working, people who have always done the right thing and put away money for their pension, but now food inflation has stretched their capacity to meet their needs and the needs of their families.
Well, I appreciate those insights. And of course, the food inflation affects the providers because, you know, you're having to go to market to often purchase these foodstuffs, and they cost much more. You know, I think that this is top of mind for many members of council. I really appreciate the efforts of my colleagues, including Councillor Carr, who had moved a motion around ensuring that council gives voice to the challenges of food security issues. And we need to continue to make more investments. But we are very appreciative of the work that many organizations, including the mission, is doing on the front lines to address this real challenge that confronts our city. Thank you, Chair.
Thank you, Councillor King. And I do want to express our appreciation to Councillor Carr for moving the motion to increase the budget allocation for food security. That is very much appreciated, but given the gravity and the magnitude of the problem, we need even more investments. So thank you, Councillor Carr.
Thank you very much, Eileen, for being here today. I'll now invite David Hole from the Ottawa Neighborhood Solutions to delegate. He's online. David, before you start, I will let Catherine Boucher and Daryl Bartra know that you guys are on deck. So David, whenever you wish to start, you have 5 minutes.
Well, thanks very much. Good morning. Thanks for this opportunity to speak with the committee. My name is David Hole. I've been involved with the ONS for the past 20 years. I'm not a data geek, but I do understand the importance of data for decision-making by policymakers, community agencies, and citizen engagement. We know that although there is a lot of data around, it's not always available in the right format at the right time because of regionalization, sector silos, and so on. ONS seeks to address this. I'm currently managing the affairs of a new nonprofit charity, Ottawa Neighborhood Solutions. Can we move on to the second slide? We have a mission to bridge the gap between research and services. When we speak about Ottawa ONS, we're talking about a collaborative partnership between the Ottawa Neighborhood Study, which is a research program at Bruyere Health Research Institute, led by the principal investigator, Dr. Claire Kendall. And they're responsible for data research, data analysis, visualization, geospatial information systems on social and health inequities. Ottawa Neighborhood Solutions is a public benefit corporation with charitable status and experience in community engagement and knowledge mobilization. It's all about taking raw data and converting it into actionable insights and building partnerships within the community of organizations that are able to act on those insights. So it's constantly a mobilization of knowledge and data for the public good and to make a more livable city. Next slide, please. About our funding, we receive community grants from United Way and from the Ottawa Community Foundation. Many organizations use our data, and many are able to contribute to the costs associated with the kind of work that we do for those organizations. We accept charitable donations, and of course, Gruyere receives research grants, where some of those funds can be reallocated to the kind of work that we're doing in the community. There is no city funding, and this is something that I'd like to see addressed. In effect, United Way is subsidizing some of the work that the city is doing using our data. And to address the existing funding gap and to establish a clear path towards our sustainability, we respectfully request that the Community Services Committee approve a motion that is included in correspondence that I sent to Chair and members. Madam Chair, should I read the motion now, or will we leave that?
If you wish to continue with your presentation, I understand that we've all seen the correspondence. So
okay.
And we have questions about it afterwards, but if you can continue.
Excellent, thank you. So next slide, please. Ottawa ONS is basically offering a place-based framework for policy development and innovative service delivery for the city of Ottawa. We use neighborhood boundaries to reflect how people live and access services. The challenge with so much data is that it's often collected using administrative kinds of boundaries. So we're talking about census tracts and forward sortation areas from the post office. These are not necessarily geographies that anybody identifies with. Local community associations don't organize their advocacy and the kind of innovative programs that they're supporting based on a forward sortation area. We developed neighborhood boundaries as a common denominator that can be used across sectors in health, social and demographic areas and environmental areas. The next slide, please. Altogether, we integrate over 500 cross-sectoral indicators to identify 116 Ottawa neighborhoods. Our data sources include Statistics Canada Census of Population, data that emerges from the Ottawa Community Health Profiles Partnership, Health System Performance Network, the City of Ottawa itself, and Ottawa Public Health, Ottawa Community Housing. We take all of this data and bring it down to a common denominator, which is the neighborhood level.
Sorry, David, I'm going to then, you are out of time. Are you to wrap up very quickly, or looking to see if there's any questions from anyone? Did you want to say a quick comment just to close?
Yeah, just to close, if you go to the last slide, it speaks to our request. We just want to be available on the same basis. We want to make sure that we're sustainable. We want to make sure that when city departments ask and invite us to share knowledge, to help develop policy and innovative programming, we want to make sure that we're there to do that. And one way for that to happen is if the city is able to invest in what we consider to be essential social infrastructure. Thanks very much.
Thank you very much, David. You have a question from Councillor King.
Thank you, Chair. And I really wanted to comment around the benefits that we really derive from the Ottawa neighborhood study and from the organization that provides its solutions. They've been providing us with detailed neighborhood level data for years now. We were, I think, had a great opportunity to see some of those statistics. And, I thank you, Chair, for hosting that presentation to members. And it wasn't just because the focus was on Rita Rockcliffe. But I've seen over a long period of time, even before I was elected to office, the great that this organization does in providing granular information that helps us understand what's actually happening within our communities, who lives there, what challenges they face, and what gaps exist in services. And the reality is that, of course, all of us, many organizations within the scope of the city are really utilizing that information, from Ottawa Public Health to the Ottawa Library Board, both boards I sit on. We know that police use it, the paramedic services use it, community and social services use data. So it's very important that we have that data, because we know good data leads to good policy. And so, despite the fact that my understanding is that there is obviously a process around procurement in terms of supporting organizations, I would really encourage staff to continue to work with Ottawa Neighborhood Solutions to ascertain whether there are ways that we can provide enhanced support to the work that they're doing. I think that they're really driving innovation in data, and that innovation really results in innovation in policy that emerges from the city. So just wanted to note that we want to have continued dialogue and discussions to determine if there are more substantive ways that the city can provide support to this organization. And once again, I really want to thank the organization for the work that it's done for probably more than 15 years plus in terms of providing the city and other organizations with quality information. Thank you, Chair.
Well said. Thank you, Councillor King. Councillor Kavanaugh.
Yes, thank you, Chair, and thank you, David, for your presentation and the information. It is very valuable, especially when you think in terms of that we always talk about we need more data. Data is so important to make decisions, and you're providing a lot of that data that is very usable. So I will be asking staff about ways that we can work together, because the Ottawa Neighborhood Study has been very valuable, and hopefully they'll consider it. So appreciate the work. Thank you.
Thank you.
Thank you, Councillor Kavanaugh. Thank you, David, for being here. Our next delegation is Catherine Boucher from the Dalhousie Community Association.
Am I here?
You are here. You have 5 minutes.
Okay, bonjour tout le monde. And,
Good morning,
thanks
everyone.
for being here. I know it's a long day and a long week, and I appreciate your paying attention for this amount of time. I'm the president of the Dalhousie Community Association, which represents the west part of Somerset Ward, which includes Chinatown, which, as you know from media reports, is a neighborhood in crisis. The closure of the safe consumption site by the province followed immediately by the arrival of a private clinic delivering, and I'm air quoting here, safe supply, which led to a lot of diversion and drug dealing, has created a perfect storm, which has resulted in huge social unrest, a rise in criminal activity, and enormous impact on local residents, businesses, and visitors. Compassion fatigue has now set in, and it's easy to see why if you walk around our neighborhood. The opioid usage is a mix of toxic drugs that are causing people to be extremely unwell. Overdoses are common on our street. Folks are now suffering from long-term medical issues. And winter is coming, and we dread the impact of people trying to stay warm in tents or abandoned buildings. I personally know of 2 fires in the last couple of weeks within blocks of my house. My neighbors, people are fearful, both those who use the drugs and those who live near the chaos that's created by this. We have a heart hub, which we're happy to have, but it will be able to house up to 65 people. I believe there's close to 500 more people who are needing such accommodation. So where is that happening? And what we need for those people suffering from this mix of drug addiction and homelessness is a high acuity supported housing, and we need it now. I know the city's auditor had a report on supportive housing that quite clearly indicated that high acuity need people were not being housed in supported housing because the money isn't there for the supports. So it made all the arguments, and I encourage you to read it or read it again if you haven't read it, because frankly, people can't get better in a tent under a viaduct. I want to say kudos to the Anchor program, which has provided amazing service to our community during this crisis. It needs to be expanded to other parts of the city. I see it's going to Kitchissippi now, which is great. We need to get the right kind of response to people on our streets. I just ended this portion saying, why is the police budget special? I don't actually have anything else to say, but I think you've heard arguments about that from other people here today. On a different note, and I want to kind of give some kudos, not to take away from my requests. I want to let you know about something in Somerset Ward that works really well. A neighbor of ours who fell onto hard times, she was being evicted for non-payment of rent. After a couple of calls, we were able to connect her to the Catherine Street hub, and they're now safe from eviction, and there's a plan in place to work on securing income sources that ensure they'll remain in their apartment. And a big piece of that, since this is up at, I've heard a lot about it today, is that there is an amazing CRA retiree who works out of the Catherine Street hub who will get her income tax, which has been, unfiled for many, many years, in place so that we can start applying for the pieces of income that she is deserving of, like OAS. The staff at the hub were respectful, tenacious, and amazing system navigators. So good things can happen when everyone works for the right outcome. Let's do that kind of work now for those who are homeless and in the grip of addiction. And I'm going to end what I always say at these meetings, please raise my taxes for this work. Merci.
Thank you very much for that. You have a question from Councillor Troster.
Hi, Catherine. First of all, thank you for highlighting the work of the Catherine Street Hub. And it was Stan, who's the caseworker in my office, who initially connected with you about this. I want my colleagues to understand how much eviction prevention we do out of my office, and how many times more and more often we're seeing this among seniors who are really in the worst shape. So thank you to the city staff who helped this woman being thrown on the street, right? This is a really big deal. Catherine, I share your frustration. I've had, just so folks around the table know, I've had 3 community safety meetings in 3 weeks. Last night went till 8:30 p.m. And it was among folks who live in Chinatown who say they feel utterly abandoned by the city and by all levels of government because of the scope of the crisis in that neighborhood. We understand sort of the linchpin that's really made things worse are decisions that were made provincially, the closure of the supervised consumption site and the rise of these private for-profit addiction clinics that we're seeing. And I share your frustration. Now, what we keep hearing time and time again is the reason the people in the worst shape are not getting housed is because of a lack of provincial money for healthcare supports and highly supportive housing. And when I ask about whether this is something the city can just choose to fund, and this is something I'm going to be asking about when we ask questions to staff after delegations, I'm told, well, the city doesn't want to take on more of a burden that should be another level of government's responsibility. Same thing with the tax clinics. But given that we're spending so many police resources in the neighborhood, I wonder if we're going to get off better by just funding the supports for the people in the worst shape. What's your perspective on that, Catherine, about using tax money to fund high acuity supports for the folks who are struggling the most right now in our neighborhood?
Well, I have to echo what staff are saying. Of course, it's a provincial responsibility that is being abdicated by the same government that closed our safe consumption site to make the kids safer. And now the kids are walking around seeing people doing open air drug use. So I'm not hopeful that we'll get anything out of this provincial government. It is their responsibility. This money should come from health. I'm old enough to remember when social housing was downloaded to the municipal sector. And the province at the time said, we keep responsibility for supportive housing because we are health, social services, all the services that have to do with people needing supports. However, that has not materialized. In the meantime, people are dying. So is there a right answer? I don't have it. We have to do both. And that's why I say, feel free to increase my taxes for that. Not so much for the police budget, but why don't we have a special levy? I don't know. It's a crisis, so we have to have a crisis response as we did during COVID. Right now people are on the street. It's cold. They're dying, and they can't. The drugs are so toxic that once they inject, they can't even get up. So our community is, like I say, the compassion fatigue has set in. People are just wanting something to happen. And I think I'm not in your shoes, but the kind of supports that are needed. And I know a lot of these people are being diverted to regular community housing that has no supports. And those people are failing. Like, they're going into buildings where there's no supports. And so they're just creating havoc in the building, and they're being re-evicted, and they find themselves homeless again. That is not a solution, and that's something that the housing branch needs to look at, but it's another matter. But I know people are trying to make sure people are housed, but these people have housing needs and so many other needs that come with the housing for them to be able to stay there, learn how to, look after themselves, pay the rent. Like, these are, people who have lost a lot of skills over the years of being on the street and addicted to these incredibly toxic substances. So I don't have an answer, but
Yeah.
I'm willing to pay a bit more.
Yeah, no, and I mean, what I'm starting to hear is that we don't actually know what success looks like for some of these folks who are in the worst shape.
No, we don't.
Of acquired brain injury that we're seeing among these long-term drug users who are on the street or living in precarious housing is so bad that we don't know what a healing narrative looks like until people have those supports, until we can see what that looks like. And I think our system is about to have a tidal wave hit it.
If I can say, I think, the 65 units of the Heart Hub, if they house these high acuity need people, they will never move. Because their level of injury is such that they will continue to need that level of support forever. And we're kind of, I'm of the generation that closed all the psychiatric hospitals, saying, well, people can live in the community and they'll, take their medications and everything will be okay, and we'll build housing. That worked for a while, but this kind of stuff, I think we're back at a semi-medical model of supportive housing, not 400 bed hospitals, but smaller, compact, supported housing that is really kind of the last place these people will live. And I think they will continue to have really high needs. That is just what this drug has, what being homeless and this drug has done to them. And I wish I could. Anyway, I would encourage people to watch the edition of the Fifth Estate that speaks to that, where Councillor Troster's briefly interviewed, because they were in our neighborhood in the summer. It's very interesting. I mean, there is apparently a safe supply solution, but unfortunately, it's another thing that the federal government is backing away from. So I'm not very hopeful that these people will get better. So if they're not better, then they need to be in housing that has continuous support. And people live on the streets of the city. That's why everybody comes to the city with this ask. And I'm sorry, because really we should be knocking in Toronto somewhere, and we'll write letters, but Yeah. Good luck.
Yeah, I mean, what I always say is it's really hard to fully understand how much more expensive it is to allow this to continue, because often the cost is borne out on the balance sheet of 3 different levels of government. So jail is one level, hospital is another, paramedics. But I know at Dunhouse in Toronto, Dr. Andrew Boozery, they've had the initial statistics from 1 year of their medical grade supportive housing, and individual patients have each saved the system something in the realm of $400,000 a year, like per patient, because these are the people that are having the revolving door with jail, with ER, with police, with paramedics. So thank you so much, Catherine. We'll keep pushing, but I just really hope that my colleagues around the table understand how difficult the situation is right now, particularly in Chinatown, and how we really need to think outside the box in terms of solutions, because we keep throwing resources at the neighborhood, including policing, and it's barely making a dent. So yeah, thank you so much.
Please pay attention. And thank you.
Okay. Thank you very much, Catherine, for being here. Our next delegation is Daryl Bertrand, Canada Day Barhaven Incorporated. Suspect Daryl's online.
Hello.
Wonderful. Daryl, welcome. You have 5 minutes.
Thank you very much, Madam Chair and councillors and staff. I've sent a letter in advance that everybody, I'm sure, has a copy of. And it's not my intention to read the whole letter because I don't want to bore you all, but you can read that on your own time. I'm just going to paraphrase. I've been the president of Canada Day in Barhaven for the last 16 years. This next year we'll be celebrating our 44th anniversary of this event. Our event brings in tens of thousands of people every year, and obviously, an event of this magnitude costs a lot of money. Our budget for the last number of years has been upwards of $150,000. And we're not the only big event, the Canada Day event in the city. I know Canada and Orleans both have very large events, and there are a few others, I think Stittsville and others, that are also holding large events. The event itself is very easy to plan because except for a few small changes every year, the event is pretty much the same every year. The problem that we have with our event and probably everyone else's event is getting necessary funding to put on this event. Just some key points in my letter. I'm going to jump right down to, for many years, we're fortunate to receive $3,000 from the city's civic events funding program. Unfortunately, since shortly after the Canada 150 celebration, our event has received little or no funding from the program, even though we meet all the criteria and remain Ottawa's largest volunteer-run Canada Day celebration. These funds appear to have been given out to smaller community events. Civic Events Funding Program, as you're aware, is to promote the neighborhood-to-neighborhood connections, including multiple activities and entertainment, appeal to local residents, foster community well-being, promote equity and inclusion. And our event, I feel, exceeds all these criteria. The purpose of this request is to ask the city to adopt a citywide policy through a motion if necessary that the parks and facility rental fees be waived for all volunteer-run not-for-profit Canada Day events that follow the justification that I have listed, being that the event must be organized and operated entirely by volunteers. The event must be open and inclusive to all individuals, regardless of race, ethnicity, religion, sex, age, ability, sexual orientation, residency, marital status, or citizenship. The event must be free to attend, aside from optional purchases such as food, craft vendor items, and midway attractions. The event must anticipate an attendance of at least 500 people, which would be required to be part of the event central program that the city runs. The event cannot be combined with any City of Ottawa civic events funding. And the rationale, as I see the clock ticking, waiving the rental fees does not require additional budgetary allocations. These fees are only collected when the event occurs. Therefore, the city is not foregoing revenue that it would otherwise receive. This exemption would be meaningful support volunteer-run Canada Day celebrations citywide, reducing financial pressures a bit, and helping to ensure long-term sustainability of these important community events. Some communities are already receiving rental support through their local councillors. If rentals were waived citywide, councillors could redirect these funds towards other essential event needs and further strengthening celebrations across Ottawa. I thank you for your time and consideration and continued support of community-driven initiatives. Thank you.
Daryl, thank you so much for your comments. You have a question from Councillor Hill.
Thank you very much, Daryl, for coming out and for providing this delegation today. And certainly my experience at the Barrhaven Canada Day over the last several years, it just leads me to a real appreciation for what a volunteer-run event can look like. And I'm well aware of the fundraising challenges you have, as this is a completely, fundraised event. So I think the points that you raise are reasonable. I'm going to work with staff and with my council colleagues between now and our budget vote in December, and I'll probably ask a couple questions to staff on this as well today to see, what kind of range this looks like. I know you cited, I think, a total of 3 Canada Day. There may be a couple more, but I think once we understand precisely what that cost would look like to the city in terms of funds that we would potentially forego, we could perhaps take a look at what that would mean. But certainly your work is appreciated. Yeah, I guess my last question there, or my question for you would be, how many other 100% volunteer run events are there in the city? Are you familiar with that?
Yes, I spoke to Event Central at one point last year, and I asked them how many Canada Day events are supported through Event Central, that being events over 500 people, and I was very surprised. The number was quite low. I'm guessing it was like 5 or 6, and that was it. I was very surprised there wasn't more large Canada Day events go on in the city.
Okay, and you mentioned the specific in Barrhaven. What's the estimated throughput of foot traffic that you see on a Canada Day in Barrhaven?
Our total attendance we've been putting at for a number of years is 30,000 people.
Okay, and you mentioned the different inclusivity components to that. It's your perspective that in Barrhaven at the Canada Day you see a little bit of everything out there.
Absolutely. We start off with a seniors breakfast. In fact, our MP appeared last year for 45 minutes, Mr. Kearney, and the people are very excited about that. Our event continues to have a kids zone, which even has a place where people can have quiet time to take care of their infant child. And we go right up to all ages, everyone from there's nobody that cannot come to our event. It's totally and absolutely inclusive. It's probably Canada Day is probably the only totally inclusive event that is run in the city at any time, where you get anywhere from babies right up to the oldest senior that comes to our breakfast.
I really appreciate your time today, Daryl. We'll work to see what we can't do here, and I wish you a nice day. Thank you.
Thank you.
Thank you, Councillor Hill. Thank you very much, Daryl, for being here. And I have also heard that your Canada Day celebrations are incredible. I'm often in the East End in my community's ones, and it's a phenomenal experience to celebrate our nation and do it in our city. So thank you for doing that. We have our next delegation. Oh, sorry. We have our next delegation, Cassandra Olsorn from Arts Ottawa. Following Cassandra, we have Cheryl Parrott and Anona Kosmak. Welcome.
Thank you, Chair. And I get to sneak right in to say good morning at 11:56. I am with Arts Ottawa. Along with our almost 400 community advisory members, we champion the arts as a vital force in Ottawa's cultural, social, and economic life. And we represent the thousands of artists, creators, and arts workers in our city. First, I want to thank this committee for its ongoing commitment to the arts and culture. We've noted in the budget that culture items, including the cultural funding envelope, will receive a modest increase. The services, programs, and funding the city provides is an important part of our cultural ecosystem and keeping our city vibrant. Arts are essential to quality of life. Public investments in the arts help facilitate broad access and participation in activities. These investments directly in artists and arts groups provide stability for them to be able to be in service to our community, providing important social benefits. The arts contribute to our belonging, our collective well-being, our mental health, and our economic growth. Venues and art spaces contribute to street safety and provide important third spaces for folks to gather and connect. Artists and arts workers, however, are facing the same cost of living crisis as everyone else, and other public funding has become increasingly competitive. The Globe and Mail reported that after adjusting for inflation and population growth in the last decade, Ontario is now the most miserly public funder. Their per capita funding through the Ontario Arts Council has effectively shrunk to $3, where in Quebec it's closer to $22. The Toronto Arts Council has achieved $25 through its funding, and Ottawa is coming in just after 12, but I'll leave staff to correct me if my number is wrong. If we want to keep artists living and working here, the investments made by the city are really crucial to that. Both the Ontario and Canadian Chamber of Commerce have released reports on the economic impact of the arts. In 2023, Ontario arts and culture sector contributed $28 billion in GDP to the Canadian economy, and Ontario represented 43% of the sector's economic impact. We know that half of Canada's artists live here in Ontario, and 1% of Ottawa's workforce are artists. Arts and culture in the province supported almost 500,000 jobs. However, the Ontario Chamber of Commerce also listed that 95% of individuals and groups find it challenging to continue working in the arts. And the Ontario Nonprofit Network in 2024 report indicated that 30% of arts organizations are at risk of closing in the next 3 years, with nearly half unable to sustain their operations for more than 12 months. There's a huge market and workforce of the arts and cultures in Ontario, and we want these artists and workers to choose to live here in Ottawa. But where they choose to work is really driven by the work and opportunities available in that region. If you want to attract them to our city and want to keep them living here because they provide huge social benefits back to residents and really big economic impacts back to the city. We need supports to keep them going. I'd note that there's $200,000 put in the budget for the 2025 increase, the cultural funding envelope, but that envelope funds over 400 allocations. So split 200,000 400 ways doesn't go particularly far. It doesn't leave a lot on the table to provide increased stability to organizations already receiving funding, nor does it allow a lot of opportunity to expand to new organizations or to equity-seeking communities. The range of the cultural funding envelope is really huge. It's a huge strength of our cultural community. It goes from recreation and amateur community groups, including volunteer run, to large organizations, institutions that are driving a lot of the work opportunities for artists and individuals, as well as to new project creation. I really worry about the future of our next generation of artists, of creators and arts leaders and newcomer artists arriving to Ottawa. How will they be able to build up community organizations, physical spaces in their neighborhood, and contribute to city and community building if new investments and opportunities are not there to support them? What I also don't receive reflected in the budget or budget magazine is the deep work that the city arts programs are doing. The city staff are doing incredible work, and the folks who are receiving money from the cultural funding envelope are also doing incredible work. But we don't see that storytelling coming through in city materials. The city is running arts workshops for folks experiencing homelessness at multiple sites, including at Arts Court. The municipal planning process engaged over 6,000 people in its process this year. The Shingman Arts Center has new world music programming, and they work with older adults in their matinee cafes. And placemaking initiatives are happening and being championed by artists like we're seeing in Senate Town's the Street Seats initiatives, pardon me. Data in the Canadian Arts Database, CADAC, which doesn't include everybody or anything. It's really a very particular slice. In 2023 and forward, it showed over 1.4 million total attendance and participation at over 3,600 public activities with over 1,000 new works created. But these are decreases actually from the pre-pandemic numbers, as are the 4,200 artists paid and the under 700 full-time, part-time jobs in the arts. So there is no more with less in our community, but the arts sector is ready to contribute to city building and contribute to broad community benefits. Ottawa is positioned to be a bigger leader for arts and culture in Canada, and the arts sector is already doing this work. But a more significant investment in the sector would have benefits for not just the cultural vibrancy of our city, but also for the economic and social as well. Thank you.
Thank you very much, Cassandra, for being here. I'm looking around the table. I don't see any questions for you, but your words are meaningful, and thank you very much for sharing those experiences with us. I now invite Cheryl Parrott from the Hintonburg Community Association.
Good morning, Chair and councillors. It's Great to be here, and you've got a long day, but you've had a lot of wonderful presenters. So my name is Cheryl Parrott. I'm the co-chair of the Security Committee for the Hintonburg Community Association. And I want to start with some thank yous first. We're really thrilled that the Anchor program has been expanded to cover Hintonburg as of November 13th. And I have to say we've already used it. So thank you so much for that. We're also really pleased to see the expansion of Armstrong Park in the budget. We have so little green space. We're about 25% of what the city calls optimum, and our population's been rapidly increasing, so we're happy to see that. But we do have some concerns, and it's about Ottawa community housing. They need increased security personnel. We're told they just have 4 security staff on shift at any one time for the 15,500 units that OCH has in the city. And that goes a long distance. In the West End, we go to Canada. It's inadequate. We were thrilled when we looked at the budget to see that there was $550,000 for OCH security services. That came up in a nice little box, a highlight box. And we were trying to figure out, well, how many extra security staff could be hired with that money? But our hopes and your tenants' hopes have been crushed with the information that we got from Councillor Leeper's office that 550,000 this year and the same amount in last year's budget was just to close the funding gap. So we're told this won't result in any new personnel, that it's just so they can maintain services at the current level of 4 security staff on shift at any one time. And this is really completely stunning. We have a 200-unit seniors-only OCH building in Hintonburg. Residents there have reported escalating violence and intimidation linked to illegal drug activity occurring in several units, and the situation has worsened over the past year. A week ago, OCH held a security fair in the building, and we were there having a table, and we heard heartbreaking stories from these seniors at this fair and through other interactions that we've had with building tenants over the last while. They do not feel safe in their home, and they are not safe. They describe physical assaults, threats, verbal assaults, being robbed, people frequently banging on their doors at all hours in the middle of the night, smelled and come across visitors in the stairwell using drugs, found clothing, food, excrement in the stairwells, needles in the library, lobby, laundry room, stairwells, non-tenants sleeping in the library, benches in the lobby, stairwells. And we've now heard these same issues from over 25% of the tenants at this building, from English, French, and Mandarin-speaking tenants. And it's very difficult for the Mandarin-speaking tenants to call security. So I'm here today asking for your help for the tenants of this building and other OCH tenants who should not have to live in fear. Many of the senior tenants in this building have health issues. Many do not speak English, French, or French. And I echo the comments from Catherine Boucher about the lack of supportive housing and supports within Ottawa community housing. OCH has wonderful caring staff, so please give them the resources to do their job. They need increased security officers in large buildings like this. There should be a live-in superintendent, as there used to be a number of years ago. Thank you.
Thank you very much, Cheryl. You have a question from Councillor Kavanaugh.
Thank you, Cheryl. I appreciate your comments. OCH is getting another 550,000. This will be very helpful. And you were concerned that this is not enough. Definitely, OCH wants to work with the community and ensure that everyone is safe. This is something that's been granted this year, and perhaps we can talk about future budgets, but it's about maintaining the current level of service so that we don't fall behind. And yes, issues are getting more complex as time goes on. And a lot of it is related to the fact that we've been pushing for supportive housing, which is another huge ask that we're asking both the federal and provincial government, that we are not equipped to handle all the needs of residents, and it spills over. So this is a demand that we're putting forward. So just, you know, putting that in perspective, because it's more than just housing people. A lot of people need supports, and it spills over.
Great, thank you.
Okay, thank you, Councillor Kavanagh, and thanks you very much, Cheryl, for being here today. We have 3 more delegations. I'm going to invite Anona Kozmak to speak, followed by Menashe Spedovic-Salowski, and then Kate Vino. So Anona, are you online, madam?
Yes, I am online. I hope everyone can hear me okay.
We can hear you perfectly.
Okay, love that. Thank you for the time. I'm coming in this delegation kind of wearing multiple hats, which I'm sure is something everyone can relate to. I work with Citizens of Centertown Ottawa Corporation. We're a nonprofit housing provider, and I'm the tenant and engagement person there. And I'm also lucky to be a board member at Arts Ottawa. So I'm going to use this time for my delegation to talk about the synergies between housing and art services and how those are key infrastructure elements. I can echo some of the comments that have already been said about the barriers to income tax filings for people to lose their subsidy, but also the very real elements of community safety that we're seeing when the colder months hit, of people trying to access the buildings, breaking locks, sleeping in garbage rooms right beside the dumpster, on any event that they can find, and the challenges that come with, tenants finding people in the stairwells and those interactions, and how, if there's a death, or how we've now had to switch to providing mandatory naloxone training to all of our staff, because that's the reality that we're facing. I think there's a moral imperative, and I understand that the province is the one to, that's on them and the feds, and, we can put it off on other levels of government, but ultimately I believe our city can punch up and solve a lot of these issues and work towards it. I know our council has a really strong political will when we want to. And I think when we're talking about things like the police levy budget and like how social services are stagnating right now. And I've worked frontline. I've worked at domestic violence shelters. I've given out naloxone. I've administered it 7 to 8 times. And the reality is we are losing people. And I know that there's another way forward. And that's where the artists come in, because we need these creative people to stay in our city. And yes, that's of tackling the affordability crisis, but also looking at programs like our Uncommon Spaces program, and how successful just having no barriers, where people could walk up, sit down, enjoy the actual culture of their city, and working to create placemaking. Art is a part of the infrastructure. It upholds and enlivens our city, and actually creates a really grounded sense of belonging for the citizens that get to be here. If you can take a moment to remember the first piece of art you've seen, or the concert, and how those moments can shift you, having the opportunity to work through your mental health and express yourself can really enliven a space. This summer, we were lucky to get a grant from the city through the Painted Up Committee and do a mural on one of our buildings. And we worked with Operation Come Home, and those youth were able to gain meaningful work and skills and funds by doing art in their city. And now when they walk by, that's them. That's their presence that they've been able to contribute wholly to their city. So it's a very real one-to-one comparison of how artists can show up for the city, make it better, and belong. But right now, with our affordability crisis, we are pushing them out. And, I know there's a lot of it's all kind of integrated between housing and artists, but really the creative elements of what artists can provide by living in this city and being supported, where they can be celebrated and uplifted and platformed, where Ottawa is a destination for tourism. And right now, the 3% budget raise for the arts and culture system is not enough. And so artists are being pushed out of the housing system, but also the city itself. So our creative brain drain is absolutely not acceptable right now. And I know that our city, you should feel like you belong to the place you were born in. And right now, what we're doing is people are getting uprooted, pushed out to higher and higher rural places, being in overcrowded houses or just not even being able to have a moment to express themselves. So when we have underutilized public spaces right now that I think we can leverage, and we're using a shared ground program at Arts Ottawa to kind of explore these ideas. And I'm really proud of the work that we've been doing. So please, if you have a moment, look out to Arts Ottawa. You can reach out to Cassandra for more, but the work that we've been doing to really uproot some of the old ways of thinking of hierarchy of governance and how we can bring more community players and actually create a real sense of community safety that's not through necessarily police or security, but through knowing each other well. So thank you for the time.
Thank you very much. You have a question from Councillor Troster.
Hi there. Thanks so much for being here. And I just wanted to thank you for your kind words about the Uncommon Spaces, otherwise known as the Street Seats program. Just so you know, there is funding for next year. It's in the Public Works and Infrastructure Committee budget to return those spaces to Bank Street and also to create 3 more in Chinatown. And I just want to echo what you're saying, because when we surveyed people about their experience on Bank Street and visiting those spaces, something like 70 or 80% of them said that it increased their sense of safety in the neighborhood. So I agree with you that the arts and programming and bringing more people to the street is a really great way to create a sense of safety. I know you were talking specifically about the arts and also about disparity in funding with social services. I also know that CCOC, I mean, your office being in the corner of Bank and Gimler, it can be a very challenging location. I'm just wondering if there's other social service programs that you think are working that need to be scaled up to help with security in that neighborhood.
Thank you so much for the question, Councillor Troster. For us right now, Center 507 is someone that we have community planning meetings. And again, very grateful for Anchor. But usually what happens is there's not often a place for people to go. So it can be like a warm spot where they're sitting in the van for a little bit and maybe they'll get a drive. I do think places like Center 507, they turned away 18 people this past week because they're at capacity. Storage is also an issue for unhoused folks. So if you can imagine carrying all of your belongings on your back day in, day out when it's cold, and losing them or whatever, that's kind of a barrier as well. So I think places like Center 507, the Centertown Community Health, I'm really happy to see Anchor and expanding on those places are really important. And I would love to see underutilized public spaces be more activated. And I think that's some way of making place-based services more accessible to folks. And I think that ties into some of this need for income tax clinics and service navigation for people. So as far as services that we rely on, I definitely think Center 507 and Anchor have been hugely, hugely helpful in diverting some of the mental health crises. But also there is still a bit of a knowledge gap of people don't even necessarily trust or know what the end result will be. And they don't know things like you could call for yourself too, and things like that. So I think as the program rolls out, that education piece will be important and crucial.
Thank you so much. I appreciate that. And actually the fact that Center 507 pretty much until the snow flew had access to money for outreach was something that I fought really hard for, simply because that facility right now is seeing such a massive overflow because it's the only 24-hour quote unquote day program in the city. And as you said, they had to turn people away last week. So the impact on the surrounding neighborhood is really challenging. So funding those outreach workers also helped with general neighborhood security around the area, but it is an ongoing problem. And I've been working with city staff to try to identify more spaces that we can open up for this type of programming, because the burden on that particular quarter of my neighborhood is too high at this point because the place is literally overflowing and a lot of these folks are really high acuity. So when they leave the facility, there's often some major challenges, and it's right near a school. So and it's right near where high school kids wait for the bus to go to school in other neighborhoods. So yeah, it can be very challenging. But thank you very much. I appreciate your holistic approach to community safety.
Thank you, Councillor. Thank you very much for being here, Anona. Our next delegation is Menashe Spivak, forgive me, Selewski. I believe you're online.
I am, yes, thank you.
Wonderful. You have 5 minutes. Thanks for being here.
Thank you for having me today to speak about the need for Ottawa to reopen more warming centers with staff open 24/7 from now, December, until March when it's cold, with capacity for sleeping and not just sitting on a chair or at a bench, and which have low barriers for access so no one's left behind. If time permits, I do have several anonymous submissions from frontline workers about their experience in having to turn people away from shelter and then later hearing about either injury or death. So a few points is the point in time count from City Ottawa that they published from October 2024 indicates 2,902 unhoused people. Earlier in this meeting, I did hear a number closer to 500. This does highlight a need for increased transparency. It'd be nice to know what the difference in numbers is, where those different numbers are coming from, and how that's used in city planning. It's indicated by city numbers that there are closer to 950 shelter beds available. So that's 2,000 people left unhoused. In a memo regarding closing of some physical distancing centers last August, mentioned the city has increased shelter capacity by 4% since last winter, and that's only 82 beds of 2,000 people, and shelters are still full. At the time of closing centers, there was a plan for sprung shelters, but some politicians like Lisa MacLeod and some citizens from Barrhaven cared more about property value than housing people that are suffering from cold and weather environments. There were development plans for housing at 1645 Woodruff Avenue and 40 Hurst Way. However, this was put on hold with the understanding that vacant sites such as 250 Lanark are no longer for sale and can now be used for shelter or housing. So I would like to know why we are paying for an empty building and not using it for shelter or housing. People have asked, what's the winter plan for those still sleeping rough, to which the city pointed us to a 10-year integrated transition to housing strategy. We'd like answers about what happens now, not in 10 years. Many of the plan's future housing opportunities are designed for specific cohorts, require a referral or vetting process, making these opportunities inaccessible to many. To meet the mandate for many services, one needs to have an address, requiring them to be known at a shelter. Again, there are 2,000 people being turned away, according to the city's statistics last year. People want more transparency regarding the city's measures of success and progress for this plan. What measures the plan's success and what indicates the need to adjust it? How many deaths from exposure to cold are required to trigger revisiting the plan? And how much do emergency departments need to be overloaded with people seeking care from preventable injuries due to exposure? We all know that a visit to the hospital costs more than it does to provide shelter to an individual for one night. As of August 2025, OPH data shows there have been 76 suspected drug overdose deaths, and these we know are preventable when people aren't hiding alone in an alley, but they are surrounded by peers and staff trained to help them. Police and politicians will say that people not accessing shelters are choosing to do so. We know this is not true. Police aren't having conversations with people because it's unreasonable to expect an unhoused person who is vulnerable to have an honest conversation with the same person that they've witnessed stealing a sleeping bag, stealing a tent, taking away their means for survival, or even being violent with other citizens. We want to know where those sleeping bags and tents are going, if police are storing them, taking them on camping trips. It makes way more sense to pay for housing than it does for a police budget to violently arrest or steal survival needs from these unhoused people. What the city needs is more warming centers. They were taken away. We've seen an increase in death and harm from cold. So to revert that, we need those warming centers open again. Oh, 40 seconds. Perfect. I can read one. So we've had frontline workers tell us things such as every time they have to turn somebody away, they think about that person they found out was dead after they turned them away. This is a moral injury to every single frontline worker. We know that shelters are full. We know that shelter workers are trying to save lives by putting mats on kitchen floors, in hallways. This is not dignified or safe, and it's a crisis. It needs to be addressed. We have shelter workers stating that families with children are trying to access shelter and are turned away.
Thank you very much for your delegation. You have a question from Councillor Carr.
Yeah, thanks very much.
Went the wrong way, sorry, went on Zoom instead of on the microphone. Sorry about that. Thanks very much for your delegation, Menashe. Do I have your name pronounced right? Sorry.
Thank you.
Yes, okay. I was just curious, did you say something about 2,000 people being turned away according to city statistics? Did I understand that correctly?
The point in time count from October 2024 mentions 2,952 individuals unhoused. That's on the Government of Canada through the city's website. Sorry,
Okay.
the City of Ottawa's website.
Yeah, perfect, thanks. My understanding was that included the people that are living currently in the hotels, in our shelters, and in our transitional housing facilities, but we'll clarify that with staff as well. Are you interacting with people that are being turned away actually from shelter right now then? Like you mentioned that you had letters from, I think it was frontline workers. Are you?
Yes, I'm helping with the What's the Winter Plan task force, and that group has anonymous submissions from frontline workers that work in a variety of different places where they are turning people away because they're at capacity and are hearing of the effects for the people that they are turning away.
Okay, we'll get to the bottom of that. But when you talk about warming centers, are you talking 24, it's a 24/7 warming center that you're requesting, not just shelters, not just when we open Lanark and extend our winter response? Is it warming centers that are more than like a day program like Center 507?
Yes, 24 hours because it's cold at night and many centers are only open during office hours. So 24/7 access to warmth where somebody can lie down and sleep and isn't meant to sit on a chair or at a desk.
Okay, thanks for the clarifications. We'll be asking questions to staff. Appreciate your delegation.
Thank you.
Councillor Troster.
Hi, thanks for being here. Yeah, I mean, I share some of your questions. I think the concept of a warming center is not, it's not, I've been told year after year, it's not really how the City of Ottawa has always operated. It's been the front doors through 311. And right now, I mean, I will agree with you. I've been pushing extremely hard for another space like Center 507 to open because it is overflowing and the burden on the people who use it and on the surrounding neighborhood has just been really high. I will have questions to staff about that, but part of the issue is it's very, very hard to find suitable buildings that meet those needs. And I also, informally 2 years ago when we had our emergency shelter task force and we asked some of our community service providers if they would be willing to scale to 24/7, most of them said no. And most of them said no because it's very difficult to find staff. And they were already operating at capacity and just did not see the possibility to scale up, including some that are really well established in the city. So are you asking for a shelter or are you asking for more like a day program that people can drop into? Because
I'm asking for buildings like 250 Lanark that were identified as possible living or shelter spaces to actually be used. There were excuses why that plan was vacated because of this or that. When those didn't pan out, we didn't revert back to opening those. We're just paying leases on empty buildings, which doesn't make sense. People are cold. They're dying from the cold. They need access to a building. If somebody's entering an OCH building and lying down next to a dumpster, as a previous person said, that's not ideal for anyone and it's not dignified. So we don't need to aim for a state-of-the-art center. We need to open up a center where somebody can come in from the cold and not get frostbite, not lose a limb, not die from the cold.
So I agree with you, although I will say what we're hearing from frontline service providers and also from our own encampment response team that works for the city is that the folks who typically will not go to shelter, it's not necessarily because there isn't a space, it's because of trauma and other significant issues. Sometimes it's people who've experienced trauma in the shelter system or have a pet or living in a male-female couple or don't want to get rid of all their stuff that the shelter is not a good place for them and that they prefer to live rough. It doesn't mean that's a good choice or that this is a good situation or it's anything that the city approves of. And I've been pushing for shelter solutions for the typical person who would not go to shelter. But overwhelmingly, we're not hearing it's necessarily because of lack of space. We're hearing often it's because of a lack of fit. What are you hearing in that regard?
I'm hearing the exact opposite. And also, critical thinking tells me that if I have three options of where I can get in from the cold, and one option has somebody who has recently abused me, the second option does not allow me to enter if I have safer supply items with me, but I know that not at the shelter, but later I'm going to use. Am I required to lose those? And then the third option is a 2 hour bus ride, and I don't have bus fare. Those aren't options. Those aren't options that I'm refusing. Those are three different scenarios that aren't fitting needs. And so if we open up more warming center, that alleviates the problem of only having 1, 2, 3 options in one geographic region.
Okay, I'll just tell you from the folks that we've been working with in my office who won't go, they wouldn't go to the physical distancing centers either. Like some of the issues are really complex. So I hear on that. And both Anchor and the homeless outreach van run through the Salvation Army will transport to shelter if you call 311, just to be clear. So
I can also tell you that each facility that has said that they can't open to 24/7, it's not because they don't want to, and it's not because it's a challenge that they're not willing to accept. It's because the city isn't giving them funding to do so. So
No, we offered funding, to be really clear. Like, I'm not sure what your sources are, but I have worked extensively with the frontline service providers in my neighborhood. So again,
one of the asks was more transparency, and I think that would be great.
Sure. Okay. And just out of curiosity, what are you here just as an individual? Are you organized? Like, do you have a specific organization that you're representing? I'm just curious about where you're coming from.
I'm here as an individual, as well as there's several other individuals that have formed the What's the Winter Plan task force. And most people are not willing to identify themselves because they work for agencies, and for fear of being penalized for that, they cannot speak out. And that's a great shame. So I'm privileged to be able to say, I'm here speaking with my own critical thinking. I don't need to rely on my workplace, and I don't need to damage my workplace relationship because I'm using my own critical thought. I'm using statistics that are out there, and I'm also just using information I have from relationships with people that are unhoused or relationships with people that are serving the unhoused.
Okay, thank you.
Thank you, Councillor. Thank you very much for being here. We are moving to our next and last delegation, Kate Vigneault from the Ottawa Community Food Partnership. Welcome, Kate. You have 5 minutes.
Hi, everybody. I am here today speaking from my role as the chair of the Ottawa Community Food Partnership. And just for some additional context, OCFP chairs the Food Security Pillar Working Group of the Poverty Reduction Strategy, which is also comprised mostly of OCFP partners. First off, we'd like to acknowledge that we deeply appreciate the proposed 15% increase in sustainability funding for food security organizations in the 2026 budget. This increase is meaningful and it sends a very important signal. The city recognizes that our sector is critical and is under increasing, unrelenting pressure to address the growing impact of food insecurity on Ottawa residents. That said, we must also be clear that while this 15% boost is essential and will have tangible impact on organizations, it still serves as a catch-up and not a transformation. We are here today to ask Council to recognize the true investment needed to impact food security in this city. Our presence here today is not an indication that we don't appreciate the proposed 15% increase, and we ask you to really hear that in what we have to share. For many organizations, we are still absorbing huge systemic cost pressures. Without a more robust long-term financial commitment that goes beyond a year-to-year percentage increase, we as a city risk merely keeping our heads above water, treading in place, rather than building toward real food security. Some of you attended the recent Food Security Symposium and hopefully had the opportunity to speak with many of the community organizations in the room. There were a lot of great discussions, ideas, and proposals to build a more food secure Ottawa. However, conversations were clouded in the reality that we at the Food Security Pillar Working Group were informed ahead of the planning the symposium that at this time, there'd be no additional funds available to implement solutions, which inherently limited the scope of what was up for discussion. We are continually being told we need to make things work within existing budgets, but we can't do both. We can't keep the current broken system afloat and change that very same system within the same resources. We are continually asking for increased investment into capacity, infrastructure, and programs within the social service sector against a backdrop of massive city investments into road expansions, land procurement for future developments, entertainment upgrades, and more. The amount we've heard associated with the 15% increase is $476,000. We understand that this is the additional amount on top of a 2.5% standard inflationary increase, which would bring the total increased funds for food security in 2026 to around $571,000. This is a drop in the bucket compared to the proposed $135 million for road resurfacing as one example that, while still important, is not as critical to the same extent as residents having access to food. Given that reality, we respectfully ask Council to consider what it means to meaningfully invest in food security solutions at the municipal level, what it will take to truly impact the trajectory of increasing food insecurity, what it will take so that the agencies on the front lines don't have to turn hungry people away, so that your residents have access to nutritious, culturally relevant food and aren't having to make impossible choices to keep up with the soaring cost of living in our city. We ask Council to consider, how will you fund the poverty reduction strategy to ensure change is actually possible? How will you fund food security solutions in our communities that already exist but cannot expand and in some cases cannot keep up with the demand due to lack of adequate long-term funding? How will you prioritize budget decisions that will increase affordability and reduce barriers, like freezing transit fares, for example? How will you fund annual cost of living increases for sustainability funding that are proportionate to the real-world impacts of inflation, rising costs of food, and increase in demand? I'd like to reiterate, we are truly grateful for the 15% increase proposal. It is not nothing. It reflects your recognition that our work matters and that those we serve matter. But we also urge you to see this as a step and not the final one. We can build a future where food security is not about emergency relief, but about resilience. We need the City of Ottawa to sufficiently fund solutions within our communities that are connecting residents to food. We need the City of Ottawa to invest in food security like its residents' lives depend on it, because they do. Thank you very much.
I appreciate you being here, Kate, and sharing that. I'm just looking around. I don't see that there's any questions for you. Thank you very much for your words. So we are going to move on to questions to staff. We'll let staff return to the table and grab their seats and get set up.
We were all waiting for each other.
Who's gonna hit it? Ross and
And I couldn't hit the button.
All right. You've got an eager crew of counselors here with lots of wonderful questions. So our first, the one who hit the lucky draw there is Councillor King. He gets to go first.
Thank you so much, Chair. And I really want to thank staff for all the hard work that they've put in on this budget. We know that there's a tremendous number of competing priorities, which we see definitely in good measure based on the number of areas that this committee is responsible for. So I wanted to ask a few questions concerning food security as well as equity investments. Just noting that we had a number of delegations talking about the challenging environment, especially the increasing need for food amongst not just our low income families, but now increasingly working families. I'm just wondering if the city can outline its strategy for coordinating with food security providers on how we will attempt to work with them to address gaps between demand and capacity.
Thank you for the question, Chair. And so, yes, you are correct that food security continues to be a key priority under the poverty reduction strategy. We recently had the food symposium, and so out of that symposium will come a series of recommendations that we will weave into an action plan that will move forward in terms of bringing various partners together, the Ottawa Food Bank, Ottawa Community Food Partnership, Feed Ontario. We want to make sure we engage Ontario associations and other food banks like Food Bank Canada and Starter Advocacy more broadly as well. So we want to be able to create as much capacity as possible within the sector and the system to be able to work on this bigger issue. Where we're investing some funding, if budget is approved, I want to bring your attention to that $150,000 for tax clinics. It's part of the poverty reduction strategy because we really believe that the answer to food security is income. It's affordable housing. The bigger issues that, of course, as a municipality, we struggle to have all the answers and levers and funding to address. But that $150,000 investment put over $30 million in the hands of thousands of people in 1 year. So that is an example of what we're doing. The community hub is another example. These are all the wraparound initiatives and supports that we put in place, in addition to working with the food sector on the food security issues.
I appreciate that, and I appreciate the advocacy around this table. We mentioned Councillor Carr's motion around food security and the movement towards investing more in these services. We're hearing demands from the community, and rightfully so, for more investments. I'm just wondering, as part of that process, will consideration of plans to strengthen capacity for mobile food services, such as the Missions food truck that regularly experience lineups exceeding their ability to serve. I've seen this firsthand in my community in Rideau Rockcliffe when the trucks pull up, especially in front of the Rideau Community Hub. There's demand there. So I'm just wondering if the process in terms of the summit and the work that you're doing with the different organizations would lead to consideration of strengthening the capacity for these types of services.
Thank you for the question, Chair. And of course, we think the food truck is an amazing initiative and really do value the Missions partnership in this very vital work. And we would encourage them to apply for sustainability funding and or project funding when those funding calls are open in the new year. That would be the best way of examining a potential funding scenario for that initiative.
I appreciate that. And since we're talking about funding, I'd like to move on to equity and the community funding framework. Within the existing community funding framework, I'm just wondering, are there opportunities to reallocate funds to priority equity initiatives without destabilizing current service agreements?
Thank you, Chair. 100% equity, looking at and using an equity lens is part and parcel of our community funding framework application. And in fact, $120,000 has been now part of our core operating budget that came from previous budget processes. And we've actually transferred that to the community funding envelope to maximize our ability, for instance, to fund Black-led initiatives, which is a good example.
I appreciate that. I was wondering if staff could identify more available funding sources within either uncommitted reserves, project funding, or emerging needs funding that could support new equity-focused or youth-led initiatives in 2026.
Of course, Chair, we always have to work within the budgeted funding envelopes that we have as staff. What I can say is that in community and social services, we take an integrated approach to funding where we, as I said, bring in an equity lens. And equity is a priority of community funding, the funding envelope, as is poverty reduction, as is community development and capacity building.
Beyond financial grants or funding, I'm just wondering what kind supports could the city scale up in 2026 to support equity focused organizations, because we are hearing issues around capacity. And, examples might include access to city-owned space or administrative support or capacity building programs or technical assistance for grant applications. So I'm just wondering what commitments beyond financial grants could the city provide to equity-focused organizations?
Thank you for the question. And that will be part of the work that we do in renewing the equity, diversity, inclusion framework and bringing that report to committee, Finance and Corporate Services Committee, in the new year. And what I mean is that is about creating a framework for the municipality where we work across various departments. So Dan might have something to offer, and other colleagues might have something to offer to that end. You mentioned, for instance, access to facilities, which is why I use that as an example. So that is part of the EDIP framework that we will be bringing forward in the new year.
I appreciate that, and I'm definitely looking forward when that framework comes before us at Finance and Corporate Services Committee and here as well. The last question really revolves around the call for more investment in quality data. I think we heard that from the Ottawa Neighborhood Solutions Group, who has been providing excellent insights for the city, for our associated agencies like Ottawa Public Health, Ottawa Public Library. I'm just wondering if you could talk through the process as to how a group like that could potentially access dollars in support from the city.
Yes, again, Chair, I would suggest that Ottawa Neighborhood Solutions be ready to apply to sustainability funding or project funding for their initiatives. And again, we value the work that they do as at the same time, we value the work that agencies like the Social Planning Council do on the equity index. So with that in mind, we really encourage these organizations to apply to the funding envelopes that are available when they become available.
Thank you so much for that. I appreciate those responses. I know that your staff will be participating this evening at one of my budget consultation for the diverse communities, and I know that this is a continuing question in terms of accessing funding. So I know we'll hear more questions this evening, but I thank you for answering my questions during this session. Thank you, Chair.
Thank you so much, Councillor King. Councillor Carr.
Thank you very much. I have a number of assorted questions here. I guess my first question is just a clarification question for Clara. We've heard a lot of people talk about the need to scale up for supportive housing for the highest acuity. It's my understanding that quite frequently the highest acuity funding for supportive housing actually comes through the Ministry of Health and Long-Term Care. Does that go through the city at all? Or is it just the funding that comes through the Ministry of Housing for supportive housing?
Chair, we take a collaborative approach to funding. We receive funding for housing-related operations. And so in a supportive housing situation, we would provide the operational funding for supportive housing and then partner with organizations that are Ministry of Health agency designated organizations that would go into that supportive housing scenario and provide the more clinical supports. Within the homelessness prevention program funded through the province, there is some ability for us to move a bit of funding around to, let's say, fund in a special case, a nurse practitioner to also be on site, for instance, if we had to. But typically, we do not have the mandate for health funding, and this is what the Auditor General sort of tried to describe in her audit recently.
Okay, thanks. Yeah, no, that's consistent with my understanding, that really, it is the provincial government who mental health and addictions care is part of the provincial healthcare system under Ontario law, and that the primary responsibility and authority to fund clinical mental health and addiction services lies with the province. So, in terms of additional funds that could be created for housing through the city budget, a couple years ago, we added the enhanced rent supplement and the large family allowance, but is really that only funding mechanism where the city could access its own funds to help scale up supports?
Chair, yes. What we currently do is we look at all the funding envelopes in front of us, including the municipally funded envelopes. And what you heard in the Integrated Transition to Housing Strategy report and what you'll hear in the 10-year plan is how we plan on leveraging those envelopes to be able to address the priority needs that face us. And one of those priority needs is supportive housing. That's why you also heard that we surpassed the former 10-year plan target on supportive housing because it became such an important answer to addressing chronic homelessness especially. And so, yes, we will work within all of the funding envelopes to be able to, for instance, provide housing benefits, which is another municipally led initiative to augment where the other initiatives funded by other levels of government leave off.
Okay, thanks. And for the winter plan, which is part of this year's budget as well as next year, do we have sufficient capacity to be able to offer spaces to everybody in the city? And we've heard concerns today from delegates about not having 24/7, not having capacity. I know we've opened new facilities, closed some facilities. If you could just speak to that a little bit, I'd appreciate that.
Thank you for the question, Chair. So as part of our winter strategy, the team has worked over the last year to ensure that we have capacity this winter. So we have over 100 beds available in the system. Shelters are close to 100% occupancy. And at the same time, we do have other beds and other beds available to bring online. St. Joseph is one example. Lanark is another one. There were questions around referrals and that process. When someone calls 311, do they receive a barrier-free approach to placement? And so the team is recognizes that there might be some systemic issues there. And what we're doing is we're tackling that. We're actually bringing staff on board to create a team that will, out of community and social services, receive the calls and triage those calls with a supervisor in place 24/7 to be able to really tackle those really complex calls, so that we move beyond this concept of shelters are full to no, there's room in the system, could be at a transitional housing location, for instance, and that person will be assessed and then placed where they're best suited. In our system, we do not turn people away. That is a direction the council gave us in the former 10-year plan and one that we continue to follow.
Thanks very much. And I appreciate that focus kind of on the service coordination aspect. And that's one challenge I find when I look sort of at the line items of the budget and all the different money that's going towards the different services. We're hearing about experiences of people that are on the streets, whether it be in Chinatown or Lower Town. What other initiatives in this budget speak to that service coordination that can better serve these residents? Because we have a lot of funding that goes towards different agencies and organizations. But then this morning, we heard Councillor Troster mention about the Catherine Hub and the work that it does. What is here that can better aid in that service coordination? We're giving funding to a lot of organizations, but we're not always seeing what we need to on the streets.
Thank you, Chair. So service coordination is something that we address as a department, and so it's a priority for us writ large. But in this budget specifically, for instance, we have 140,000 to continue the work of coordinating the Downtown Safety Outreach Partnership. So the Downtown Safety Outreach Partnership is an effort to coordinate the outreach initiatives that exists in the market and larger downtown space. Bring better coordination, better data sharing, data collection, and ensure that service providers on the ground have what they need to actually refer people on to the services that best meet their needs. So that's a good example of the kind of tangible program that will come online in the new year and for which work has been undertaken over the past year.
Are there any efforts to look at all the different outreach services that exist? I'll let staff answer that question instead of Councillor Troster.
Chair, the program I just described is exactly that.
Okay, perfect. Thanks. I was just clarifying that. Thank you very much. Just with respect to the anchor expansion and the $700,000 to do that expansion, was it an expansion or was it just changing the boundaries of the Health and Resource Center? Can you confirm that that $700,000 that came from the Solicitor General as did the additional funding, the original funding for the program?
Chair, the original funding from the program is from the Solicitor General, and that is the funding that has funded the setup, scale up, and then the prototype that is currently active in Centertown. And I want to apologize for some of the confusion around this. So what is existing in Centertown right now with the two organizations, that the two organizations are actually enabling the program to just fit within their organizational boundaries. So it is a bit of an extension of the existing program. It's separate from the 700,000 that's in the budget. So the 700,000 that's proposed in the 2026 budget will accelerate our ability to expand Anchor to another community or multiple communities. We have to do some work there. We have to refresh the data work. We have to undertake a needs assessment in terms of potential communities that come out of that data work. We have to work with the community groups on the ground to ensure there's enough capacity to actually respond to calls, and work with existing partners like the Council on Substance Abuse and Mental Health, the Guiding Council, who were part of the initial development of this model, because we have to keep in mind the prototype exists to really provide a proof of concept because we all recognize that there's a need. But it did come out of the Abdi Rahman Abdi situation, inquest. It is part of actually the inquest report and requirements. So we're going to continue to work with our partners. And we have to continue to work with those partners to do all that base work I just described before we even can speak more about what that 700,000 will actually do. Our hope is that we can expand and then scale, because we believe that this program could be useful for multiple communities.
Yeah, absolutely. And thank you very much for that clarification. Just a clarification just on the food security money, and I'm sorry if I missed this. I know Councillor King was asking questions about that. The increased investment this year, I think, is $476,000. And is that going to the same organizations that received the 10% increase last year? It's exactly the same funding?
Yes, Chair. So within the community-funded agencies, we have about 29 agencies that provide either their food banks or they provide food as part of their regular programming. And those are the 29 agencies that would receive the 2.5 cost of living. And then they would receive the further percentage to bring the total increase to 15%.
Okay, thanks very much. Chair, my other questions have to do with splash pads and things, so I think it makes sense to move to someone else first.
No, that sounds good. Councillor Troster, you're next.
Thank you so much, Chair. So Clara, or to city staff, if you could just confirm one more time. So it's your assertion that if somebody calls 311 and says they need access to a bed or a warm space, they can both access that with our current capacity and be transported there if necessary.
Yes, Chair, that's how the system works, but we want to acknowledge that there might be breakdowns from time to time because the staff answering the phone at 311 may not be a trained caseworker. So we're trying to fix that.
Okay.
And that will be addressed in the coming months.
And then you mentioned Lanark for overflow capacity. At what tips the balance for staff to be able to open that other facility?
Perhaps I'll ask Kale to come on and talk a little bit about how the team is monitoring capacity and when they would trigger an opening of, let's say, or a activation of the occupancy agreement that we have there.
Thank you, Chair. So we do have that as a backup facility. One of the things we're really looking to do is, as Clara mentioned, leverage those 100 beds that we do currently have available to us. So really what that's about is shifting system capacity around from some of the downtown shelters and shelters like Cornerstone to people who are eligible or a fit for transitional housing and utilizing some of the beds there to free up system capacity across the board. We are working very closely with the Housing and Homelessness Leadership Table on this strategy to be able to implement it. In terms of triggering that response, we would be going to other backup mechanisms, as Clara mentioned first, to the St. Joseph site. We also, as a reminder, have 3 additional floors at the YMCA, which will start coming on early this winter, which is an additional flexible capacity. So we would go with using St. Joseph and again, transferring clients who are eligible for that service over there or YMCA before we would go to Lanark. And certainly from our side of things, we are able to scale up quickly. We do, of course, have those backup plans and we're able to activate this quickly. So again, it's looking at the numbers as we see people come inside and activating strategy by strategy as we see the numbers going up. But again, just to be very clear, we are in a better position than we've ever been in the last 5 years in terms of bed capacity. And we do believe with the way the numbers have gone the last few years, we would have sufficient capacity without activating Lanark at this time.
Okay, so, but my understanding is a lot of the new transitional facilities are considered lower acuity. So for someone who's higher or highest acuity who needs to get off the streets on a freezing cold night, where do they go?
Thank you, Chair. So that's exactly what I was saying. What we're trying to do is move people who are lower acuity that are fit for those transitional housing sites into those sites. So we're working closely with all the different shelter providers to make sure that those beds are filled up in the transitional facilities for people who are eligible, and that will free up the needed capacity in the emergency shelters frontline. But again, even within our existing processes, we are not turning people away.
Okay. And I've asked this question many times before because, as you know, Center 507 in my ward is now at over 100% capacity. I'm hearing they had to turn people away last week. And as you know, the situation in the surrounding neighborhood has become really, really difficult. What is our progress on opening more 24-hour spaces for people, not just in one location? Another day center, another program similar to 507.
Chair, this is an ongoing complexity in the work that we do. We continue to work with existing day programs, shelter providers. We continue to have conversations with the federal government, provincial government, and we'll continue to do that. And I think Kale mentioned the Housing and Homelessness Leadership Table, and that really is the group that we're looking to provide some critical thought, if I can use the previous delegates' reference, around this issue and what it is that we can do collectively as a municipality and partners to be able to address the need for more low barrier drop-in. It is a gap in our system that we do not have enough low barrier 24-hour drop-in for people with the highest needs that could stabilize and assist them to move on to more permanent housing. And for that, we really need a full-out systemic approach and the partnership of the provincial government, because we would need Ministry of Health funded organizations and agencies there. Right now, we want to acknowledge Shepherds of Good Hope that does amazing work in this space. But it is something that the Housing and Homelessness Leadership Table will need to tackle as part of the next 10-year plan.
Okay, I'm going to ask one follow-up question, then I'll save the rest. I'll go back on the list because I understand that we want to break. Is there a legal impediment to the city funding medical supports for the highest acuity folks in the city? Is this a jurisdictional issue in terms of who should be funding this, or I just want to know if there's a legal impediment.
Chair, I'd have to defer that question to legal services.
Okay.
But for us as funded organizations, as service system manager for housing and homelessness, we must follow the funding guidelines that the other levels of government provide. And so we must fund within those funding guidelines, and that's what limits us.
Okay, well, I'll just end with a comment. And I'll go back on the list later. But my concern, and you've heard me repeat it over and over again, is that I have a public health and a security and a homelessness and an addiction crisis all happening in several hotspots in my neighborhood. As we know from the Auditor General, these folks are being consistently turned down for housing, and they're getting worse and worse every day that they're out on the street. And now we're spending a ton in policing and paramedics and all sorts of other city costs, whereas if they were housed with supports, it would alleviate that cost for the city. So what proportion right now of the operational, so are we funding any operational costs for highest acuity supportive housing right now? Like out of city money?
Chair, the total budget for supportive housing is about $33 million of our total budget. That includes combination provincial and municipal funding. And it's for the base operations of a supportive housing. Typical 40 to 50 bed supportive housing, it's about $2 to $3 million a year in operating funding. But then that has to be augmented by the clinical funding. And so other organizations that, as I mentioned earlier, are public health transfer agencies would be the ones to then come in and provide some of those clinical services that are so desperately needed.
So right now, what is available to the highest acuity people who are currently either sleeping rough in inadequate housing or in the shelter system?
So Chair, I'm going to ask Cale to perhaps add a little more detail around what the system looks like for and what's on offer for the highest acuity.
Thank you for the question, Chair. So I think in addition to what Clara has mentioned, we do fund a number of buildings that are intended to support higher acuity clients. One of the gaps we're seeing is that when new supportive housing builds are coming online, as had been mentioned by the auditor, we do not have dedicated health supports and funding. And as Clara had also mentioned, those are typically funded directly to a health serving agency from the Ministry of Health. What has been a positive development is we're partnering with Salus and the Heart Hub from Somerset West to be able to offer high acuity supportive housing with one of their new builds. But again, this opportunity in terms of the scope of the need is not completely meeting it. So as part of our work in the supportive housing audit, we're going to continue to identify the health and housing needs to support those highest acuity clients. And that was a need identified in the audit. So as part of that, closer to the end of 2026, we're going to be developing a plan with the community, including the health sector, on what those needs are going to be, which of course will be tackled through the 10-year plan with the Housing and Homelessness Leadership Table. All that to say is there is continuing to be a higher demand than there is supply for the highest need supportive housing. And really it is getting those health supports secured through our health partners to be able to offer those high need supports like we're doing with the Heart Hub.
Okay. And I appreciate the position we're all in, but my community is saying it's not good enough. It's not good enough because the chaos that we're dealing with in the neighborhood from unmet need is leading to an increase in criminality, a huge burden on paramedics and police, increase in overdoses. I mean, I wish you could have heard the community meeting I was at last night. So I'll just leave it with that right now. Thank you.
Thank you very much, Councillor. I have had a number of requests to take a quick bio break for everybody and to stretch your legs. So I'm going to awkwardly break in the middle of questions, give everybody a chance to stretch, and I would like to resume the meeting at 1:25 on the dot. Okay. Thank you very much. We do have quorum, but I ask that not one person who's here right now leaves until we get a couple of more bodies back. And because Councillor Brockington is next in line and present, I'll go to you, Councillor.
Great. Thank you, Madam Chair. I just want to say before I start asking questions, I came back to this committee mid-year. I actually switched from environment to this committee, and in doing so, I recognize the importance of this committee. As much as we love committees that we chair and all the good committees that exist, as what was said at the very beginning, this committee, at least in my opinion, deals with the most critical issues, the community services of our city. And the budget is massive, but also all the subject matter that we deal with. So I appreciate the budget that's before us and all the work that's gone into prepare. I have a question that will be all over the place as well, but page 7 outlines the Ontario Works program, money in, money out from the province. Does the city of Ottawa receive any type of funding for administration of this program? It was dollar for dollar in out. Are there any funding for staff that we have to provide, or are staff that administer this program paid for directly by the province?
I can start, and then if there's a detailed financial question, Cyril can jump in. Excuse me. So the municipality receives a dollar for dollar amount for the distribution of benefits, and that's the largest amount. That's a complete transfer of funding through us to clients. Then we receive an amount for delivering the program. So yes, administration's covered there. And then a portion of that amount is actually 50-50 cost shared. So the municipality does contribute towards the operations of Ontario Works. What should be underlined here, notwithstanding how much we value support from the province, they have not increased that budget since 2018. Neither on the delivery of benefit side, nor on the administration side.
Thank you for that. My next questions are about the wait lists for both childcare services and the long-term care home. What is the current wait list for both cohorts, kids wanting or needing childcare services? What is the waiting list to get into one of the city-run long-term care home?
And Chair, we can follow up with the exact number. The childcare wait list is approximately 8,000. And the long-term care is about 3,300. Now, within the 3,300, it's possible that some people have chosen multiple homes, so some people might be counted twice.
And what proportion of those on those two waiting lists receive a service in any year? Like what are we able to transition off the list and provide either childcare services or housing?
Chair, perhaps on the childcare side, I'll ask Jason to come on and explain how that system works. And then Dean, I see Dean's there as well. So I'll throw it over to each of my colleagues to answer those questions. I'll start with Jason.
Yeah, thank you, Chair, for the question. If I understand, Councillor, we serve about 26,000 families a year in the national system or the Canada-wide system. So we're meeting about 70% of the demand in Ottawa, and that's where Claire referenced our 7,000 or 8,000 families that aren't able to access the system.
Just to follow up, if I may, how many people come off the waiting list for childcare services in any given year?
Yeah, Councillor, I don't know if I have the exact number of come off. It is obviously complicated because, children are pretty much in the system from 0 to 3 and then as they enter into school. But as I said, we have about 26,000 children who are benefiting from the system. And then it's always just a question of how many kids age out, how many kids are coming in. So I don't have an exact number on what that happens, but we are able to serve about 26,000 a year.
Thank you. And just on the long-term care home waiting list?
Madam Chair, Claire is correct. We have about 3,300 individuals on the wait list today, and we have approximately 250 admissions on an annual basis to the long-term care homes.
Okay, I appreciate that. Thank you so much. Pages 32 and 33 of the budget talk about a lot of things, wading pools, beach operations, all the different programming, aquatic programming we offer. Can the GM talk to us about lifeguards, in particular, the supervision staff at our wading pools that require lifeguard services? Are we making any inroads or any increases to lifeguard FTEs?
Chair, two parts to that. One is that we did experience during the pandemic a fairly significant drop-off in availability of lifeguards. And that's because the certification programs essentially shut down for 2, if not 3 years. And there seemed to be a reluctance coming out of the pandemic for people to go back to work in those positions, either because there were offers of employment that were richer than what we could afford. And some of that has been addressed through an adjustment in the wages that I referred to earlier. There's now a collective agreement that has been harmonized with our part-time to the point where we no longer really have a shortage of lifeguards for city services. The wading pool attendants who are not lifeguards, who do not require certification, that remains a bit of an up and down depending on the year. It has been in some years difficult to recruit because there is no natural stream for summer employment for these people to come off of spring employment. Unlike our summer employment for lifeguards, most of them either stay in pools and continue or come out of pools and go to the beaches in the outdoor pools, but there's a direct link. With wading pools, it's primarily all new folks that are coming out, primarily high school students and some college students. So depending on availability, they are positions that remain a challenge to fill every season because we require about 300 new employees to do that work. But we have been able, for the most part, to staff the pools for the entire summer.
That's very good to hear. And this year we were able to open select wading pools, I think a week earlier due to the warmer weather. Are we heading in that same direction in 2026?
Chair, in last year's budget, council approved $48,800, I believe is the amount that allowed for early opening of for 3 weekends ahead of the season for our first cohort of pools and for 2 weekends in our second cohort of pools, which meant that essentially the June weekends were covered in terms of opening at 5 pools. So that is the cost to do 5 pools in each cohort, 10 overall. That funding is not in this year's budget. Last year it was added as part of motions and would require an intervention at some point, a motion through committee or council.
And what was that budget pressure?
It'd be about $48,000 this year.
48, okay. Swimming lessons at times is like the Hunger Games scenario for parents to successfully register their child or children for aquatic programming, including swimming lessons. What is our ability to increase capacity for these lessons?
Chair, we have done some work in the last few years to help maximize and optimize the use of pools, added sessions, added capacity to share lanes and put more classes in the same at the same time. But we remain constrained by the number of pools we have. So that is why we are working on, one of the capital projects that are in today's budget is for a new pool in Riverside South, which will greatly help even though there is strain across the city in terms of capacity, it's particularly acute in the west and south ends of the city. Excuse me. So pools like Minto, Barhaven, for example, will have, after a registration night, waiting lists of 4,000 people looking for similar for Richcraft, Canada Richcraft, but most pools end up with a waiting list. So we are working on additional pools. We are working both in terms of Riverside South as well as a potential partnership with Carlton on building a 50-meter and 25-meter pool in that area of the city. And that will be the key thing. We are also looking at doing more outdoors at our outdoor pools on a seasonal basis because, again, there is summer pent-up demand, and this does provide us an opportunity.
Okay, that's good to hear that, you're thinking of options. Just wave at me when you're tired of hearing from me, Madam Chair.
Right now.
Page 37, just fees to park. Mooney's Bay and Petrie Island have different parking rates for some reason. Petrie Island has a season's pass. Mooney's Bay apparently doesn't. Why is there a difference?
The Mooney's Bay parking fees and structure was set up essentially when Canada Post moved in and was really meant to deal with the issue of daytime squatting by Canada Post employees who found convenient free parking there and filled up our lots. The Petrie system came many years later, I believe, not since 2010 or something like that. And it was really designed at the time the mayor had asked us to help offset the incremental cost of supervising that site. And it was what was adopted was really a budget solution for that year. So you're correct, they are slightly different in terms of approach, different times and different underlying reasons for their existence.
Thank you. That's the community I live in. I thought I knew a lot. I do know a lot about that community, but I'd not known that. As an aside, there's a lot of residential streets just south of Canada Post where we have parking restrictions during the weekdays. And it was simply to combat the amount of federal government workers parking in the neighborhood. Okay, last question, and then I'll yield. And this has caught my eye, page 132. Artifact and art collection restoration. The fund supports the professional care and management of 300,000 objects and irreplaceable historical and cultural significance in the city's art, artifact, and archaeological collections. We need to open a museum. Another one. Can you just explain what this, what does the 300,000 collection contain? And where are these artifacts? I know that some are on display at the various, but is most of it in storage? And anyway, please.
Chair, that's correct. Most of the artifacts belong to the 5 municipal museums and are part of their inventory, much of which we inherited at the time of amalgamation from the various municipalities that had museums. Some of it is being exhibited on a rotating basis in the museums and traveling school shows and educational outreach and those kinds of things. The rest of it is stored in city buildings, and we are looking at that. Earlier, I referenced the facility rationalization, and the approach from legacy municipalities that have been continued with the new is to take buildings that were nearing end of life and fill them with this stuff. And that has resulted in putting up a real challenge in terms of what to do with it in order to be able to reduce the burden of carrying those buildings that are end of life. So a couple approaches to that. One is deaccessioning, bearing in mind that these are items that were donated to the city by families, by estates. And as part of a museum approach to this, the deaccessioning does require that we offer to give it back to the donor. And if not, we follow a proper deaccessioning. So we are doing deaccessioning, and we have set a goal of reducing that inventory significantly over the next few years. And it is a case where we may be carrying duplicates. We may be carrying things that, even though someone was very kind to donate it to us, is not germane to the core of what the museum is trying to display. So one of those pieces is to deaccession. The other issue, which we have been working with Bloomberg on, is looking at municipal storage and conservation, not just for museums, but as a broader, we have kind of appear to have reached a point in the city's life where we are storing a lot of things in a lot of different buildings, and we probably need a better approach to storage and conservation. So that is the other aspect that will ultimately result, I believe, in a storage strategy to help sort some of this stuff out.
Do you have an idea of what the collection is worth?
I do know this, but I can't remember the number right now. But I could certainly let you know. It would be a significant amount.
This includes I think in the 2014, 2018 term, I filed an inquiry about the art that City of Ottawa owns. We have a group of 7.
The art would be in addition to that. The art, I believe at the last count, was $28 or $30 million in terms of appraised value. The museum collection, I can get back to you on what it's worth.
No problem. Thank you very much. And thanks, Madam Chair.
Thank you very much, Councillor. Dan, I'm disappointed. You've always told me you know everything, every answer to every question. For you not to have that, I tease. I tease. We'll move along to Councillor Kavanagh.
Oh, okay. Thank you. Yeah, I thought it was Jessica too. Thank you very much. First of all, I want to thank you for your work with Ottawa Community Housing and the partnership that we have in creating more affordable housing and finding funds for the programming. You're aware of the Bumblebee project that Ottawa Community Housing is working with community partners to hopefully attract funding for this very, very needed service. We need more services that support people so they can live independently, because it's just not working the way it is. Do we know if the province has indicated if they will be increasing the homelessness prevention program funding for the City of Ottawa? Do we have any indication?
Chair, no, we have no indication, and we have no expectation that they would be increasing at this time.
Okay, well, let's continue to hope, because I think it's really important in terms of that requirement. It's hard to build more housing without having that need for those with high acuity to be housed successfully. We do have programs that are there, but they're very, very small. So anyway, we'll hope that the province responds. I heard your answer to the other questions related to that, and hopefully that happens. But appreciate the funding for OCH security as well. That is much needed, and that is very helpful. In terms of the Ottawa neighborhood study, we saw a great demonstration of the work that they do, and it's about data. And data is something that we make very good use of, and it does help us in terms of making decisions on where to have programming, for example, such as like the programs like the neighborhood ambassador programs and things like that. I heard your response to Councillor King about that they should be ready to apply. Do you see that, a need for more data like this? Is this something that we could make use of?
Chair, of course, community-based data is always very useful. We work with multiple partners, including the University of Ottawa, on projects that enable us to collect community data. And I'm very proud of the work in our department, actually, where we have a data team that works as part of the community safety and well-being. It's policy analytics, and there's a data team that does exactly what you're saying, works with the Ottawa Neighborhood Study, the folks who run the equity index, Stats Canada is constantly purchasing data, sharing it, creating open data platforms, and also contributing to our efficiency as a department. So I don't have the number in my head, but dozens and dozens of dashboards have been created internally that enable us to be more efficient in our client service delivery, in our data sharing, in our record keeping, all as a result of our focus on data as a department.
Thank you. I know that I'll be making use of the information that there, because it is broken down by wards and neighborhoods, and I'm finding it very useful. So I think this is something we should look at. Thank you. I'm going to switch gears and give Dan a turn. Porta potties. They have been your favorite topic, Dan. They have been very, very valuable. I can't say enough. This past summer, we had a lot of people out at Britannia because of the big event that they had. There was more people than ever. Sometimes they're early in the morning, but no bathrooms except for near the parking lot. And it's something that's still an ongoing need. Can we count on the porta potties that were promised in the past? Are we going to continue to have them? And is there any chance to build on them? Because I'm still seeing a great need, particularly because the season is lengthening. It's not just when the beach is in operation. People are coming the beginning of June. They're not, they're continuing to use beaches in end of September, sometimes October. So, and the buildings aren't open, and it's like one porta potty for the entire park.
Thank you for the question, Chair. We now have a budget of over $200,000 for the rental of porta potties, and this is something that we do on an annual basis. What council approved last year was an extra $4,500 per ward, so about $50,000 to cover all wards, to add additional porta potties. That money and the monies that were approved in previous year's budgets is there and is available for 2026. So we'll be able to provide the same level of funding to each of the wards. There has been no indication at this point of a motion to add to that amount. Generally, it's been in the area of $50,000 that has been approved, and that really buys rents, to be more precise, 2 porta potties per ward for 6 months with 1 cleaning per week. Councillors have the flexibility to use it in different ways based on the ward needs that they have.
Thank you. I think we should continue to take a look at it because of the lengthening of the season. One thing that was a big success this past summer is the summer camps at Ron Colbus, to making good use of this facility. And it was targeting kids that may not have had an opportunity to have summer camps. So I hope to see that continued. It was a very successful program as well. I was able to talk to the organizers along with some of our emergency services staff to have sessions on water safety where they could, because of the location, it's right at Ron Colbus Lakeside at the beach, to do demonstrations of the importance of water safety. This is a very important topic in this community because of the past tragedy. And I'm hoping to continue that, and I'm hoping to have your support to have that coalition with emergency services.
Chair, it would be our intent to continue. This is something we've done cooperatively with Clara's department, who provided some of the funding to help support this. So if that is in place, we certainly stand ready to continue the partnership with CSSD and, of course, with paramedics that help provide the water safety sessions, which I agree with you, target the right audience with the right message and is, I believe, effective in terms of being able to sensitize people to the dangers.
Much appreciated. Most of these kids have not been exposed to water for entertainment at all. They're new to Canada, and they so splash pads are quite different from going to a beach. So it's really important and very valuable. So I appreciate that. Thank you.
Thank you, Councillor. Vice Chair Bradley.
Thank you very much, Chair, and thank you to staff for all the answers to the questions so far. I just wanted to harken back to food security, more on the funding strategy for that. So there was $476,000 for this year, but it was funded through tax stabilization. So is this going to be a base funding adjustment moving forward in future budgets, or is this just a one-time adjustment for this year?
Chair, for this year, it's one time.
So the 15% then, unless we introduce it again in 2027, it won't be there?
Chair, either we introduce it or we reevaluate the overall direction set by council from a tax target and how everything kind of comes together. But this year it's one time and we can revisit the next cycle.
Great, thank you. I have the Pavilion Food Bank in my community, and they do amazing work on, shoestring funding from the city is how they would probably describe it. So this investment, I heard that it was going to go to the 29 agencies. So would the Pavilion Food Bank, for example, expect to see a 15% plus the 2.5% increase in their allocation from the city this year?
Chair, it would be the 2.5 plus then the difference to get them to 15%. So 15% includes the 2.5.
Okay, thank you. I'll move on from that. I did notice that there was funding $50,000 for Indigenous development training in the budget. I believe that that's for senior management, but I'm hoping that maybe you can elaborate on what that is specifically and who that's for and how that money will be spent.
Thank you for that question, Chair. Yes, the $50,000 that's proposed in the 2026 draft budget is for Indigenous relations, and it would be part of the base budget, and it's to facilitate the ongoing work of creating education and awareness and capacity building in the organization for us to be able as an organization to fulfill our commitments to reconciliation. And it's not just for senior management, it would be for staff as well.
Could you maybe give me a couple of examples of specific programs that you're looking to implement with respect to training? I'm only asking because as the liaison to the consultative circle, I've heard from Host Nation as well as urban Indigenous folks that they're really looking to see a greater understanding across the organization in working with Indigenous communities and what consultation means and who they're working with. So is there any specifics that you might be able to share?
So, Chair, the one specific is to essentially to recreate an online training offer. We used to have one. It's now outdated. So it's specific to Indigenous relations, to host nation, to urban Indigenous realities. And so that's one thing the team is going to be working on in 2026. And then to your point, we want to work with both host nations and local urban Indigenous to work with them on what it is that they would like to work with us on and contribute to. And perhaps we can facilitate with them through that funding some collaborative, other collaborative training or educational offers that right now are undefined because we want to have those conversations with the Indigenous communities.
Thank you for that. And I really appreciate that level of investment. And I also really want to thank Dan Chenier and his team. Last budget, I had put forward a direction to look at opportunities to fund a staff person to act as a liaison between the consultative circle and the city of Ottawa that would be hired by host nation. We weren't able to find that funding at that time, but I'm really happy to see that we have $100,000 of base funding for that role. The depth and the breadth of the work that consultative circle does is quite amazing. And we've got a lot of actions within our protocol that we'd like to see implemented. And I think having that staff person will really open up a lot of opportunities for us to make greater progress. So I want to give a huge thanks for that. And I know that will mean a lot to the folks who participate on that circle. I'll move on more to Parks and Recreation. We had a new CIL intake process this year where council members were asked to, provide different projects that they'd like to see in their communities using cash in lieu of parkland funds. I know we've had in the past some struggles with allocating park planners and actually getting those projects underway. And I can only imagine that you've been inundated with a lot of creative projects from my colleagues across urban and suburban and rural communities. And I'm just wondering if there's any reflection in this budget of increased capacity for park planners to actually be able to deliver those projects.
Thank you, Chair. There are no new resources planners in this budget. However, just this fall, there has been a realignment of responsibilities between our CFS and the planning department in terms of responsibility for development. And as in the past, some of our planners, probably up to 12 or 15 of them, did a combination of project management, splash pads, benches, those kinds of things, as well as doing development review from the perspective of recreation, of what are the parks that are going to be required, what should they have. As part of the realignment, all of that responsibility has gone back to the planning department. And so now we really have become a project shop. And so even though we do not have additional resources, we have the resources that we have can concentrate on park projects. The process that Claire O'Donnell, who was brought on to really try to bring some order to this, she has undertaken that process to get a sense of priority from each of the councillors and to allow us to do reviews ahead of time of the projects that are coming our way, the funding that will be required and the level of effort. And the idea, obviously, we won't be able to do them all because there's probably $40 million in pent-up CIL now because of the Ontario Land Tribunal freeze on CIL. Release of that will obviously create great opportunity, but also a significant challenge. And so what we want to do is work with each councillor, and that's a process that we're about to start with the fall intake, to be able to select what are the projects going into 2026 that you want us as a priority to assign planners to, so that we can get the important things done first.
And you feel confident that you have the existing resources to be able to get one project done in everybody's community over the next couple of years?
Chair, I believe that with the resources we have and the goodwill of members of council to select priority projects and let others go to another time, that we can satisfy every ward's priority requirements.
Great, thank you. I'm not sure if this is for Dan or for Andrea, but I'll tell you just a little story in my community. We have the beautiful Greenboro pathway system, and along this pathway, there are many benches. Now, over the last couple years, the benches have been damaged operationally by snowplows, and so I think I had about a dozen or more removed. And my assumption was that they would be replaced. Obviously, they were damaged by the city and that we would have an asset management plan to replace these small park furniture. But to my surprise, I was told that they couldn't go back in their existing locations because they were interfering with operations, but we also couldn't put them on another place on the pathway because we had no funding for benches. So I'm seeing here in this budget that there's two different funds. One, the minor park improvement fund that has $300K that says it allows for small scale additions like benches, picnic tables, bike racks, etc. And then the park amenities upgrade fund, $400K, which appears to be similar. So am I to take from that there is going to be funding for me to get the 12 benches that I lost replaced next year?
Chair, we do have 350,000, which is split between the two sections of the city, so east and west, which also includes core and south. We are developing a list in terms of what is possible, so we can take that away.
I appreciate that because I was a bit surprised that, obviously park furniture over the years will fall into a state of disrepair. We do our best to maintain it, but that when it's removed, the community expects that it's replaced. And I expect that we have an asset management place that those things would be replaced to. And I was told specifically it was a budget issue. So I'm happy to see this funding, and I'll take that offline with you, Andrea, to follow up because the community would eagerly like to see their benches back. That's it for me, Chair. Thank you.
Thank you very much, Vice Chair. Councillor Hill.
Thank you very much, Chair. A very good discussion today. Much appreciation to all of the staff that brought this budget forward. I think we're doing some really good things for the community in here. I wanted to highlight one angle from my perspective on the board with the Ottawa Veterans Task Force. I know that there are a number of different pieces in there that are championed, one being housing for those who are living rough, who have lived a life of service in the past, one being with regard to career transitions, and then another in healthcare and supports for veterans. We've had great success with the development of Veterans House, which is permanent housing for veterans who were once homeless. I know that there has been some demand for either transitionary housing or also to do some gender separation and to support those women veterans who presently their home is at Veterans House or could be otherwise. But there could be some concerns, with the ratios that go with, 37 male occupants and then 2 or 3 female occupants. I just wanted to follow up to see if there's been any success in that, and if our budget next year and or any coordination with the federal government is going to allow us to see an expansion of our Veterans House footprint to include some gender separation for women veterans who are homeless or that need some housing supports.
Thank you for the question, Chair. I'm going to ask Kale to provide some detail on some of the work that's been undertaken.
Chair, and we've actually made a large, as you're mentioning, Councillor, a large bit of progress on veterans homelessness. And actually, earlier in the year, we got to highlight that we've reduced in Ottawa close to 30% the number of veterans homeless. We continue to make investments in veteran-specific caseworkers to really identify people who are housing precarious or experiencing homelessness who need these supports and have that dedicated expertise in terms of veterans programming to support them through Veterans Affairs Canada, that type of thing. We also have worked very closely or continue to do work with the Built for Zero Canada-led initiative that really is working to support veterans. It's a specific working group with veteran serving organization, and a recent development which is really going to help do some of the pieces you mentioned about potentially doing some dedicated space for gender separation is around the federal government's veterans homelessness funding. So it's similar to our Reaching Home core programming. They are interested in actually handing over that funding to the city to be able to be the administrator of that, and that'll provide a lot more of an opportunity to work at the systems level across the various veterans organizations with the city, including the council-led Veterans Task Force. So although we don't have immediate capital funding identified, this will certainly support on the operating side of things as we move into next year. So hopefully with the coming federal announcements on what the capital program is going to look like in the coming years, we'll now have the operating funding to be able to expand on that.
Thank you very much for that, Kale, and thank you, Chair. Appreciate the time.
Thank you very much, Councillor Troster.
Thank you, Chair. Under the GM's office in Business Technical Support Services, even though the staffing and capacity line has gone up from 2025, there is a decrease year over year from 2024 to business support services of $462,000. So does this decrease mean that there are fewer staff working on that end? And what pressures have changed to justify the reduction of staff, or is this just a gapping issue? I'm just curious because I know we talk a lot about the front line, but we do need that admin support.
Sorry, Chair, to whom are you directing the question?
It's under, well, GM, Business Technical Support Services, the GM's office. It's under the budget. Oh, good question. It's Community and Social Services. Sorry. Apologies. So it's in the Community Social Services Department operating resource requirement. There's a decrease year over year to business support services, and it's almost $500,000. It's under staffing and capacity on page 2 of the CSSD budget. I'm just wondering what that represents, who we're missing there.
I can speak to it at a high, I know it's not a staffing reduction because there's no staff cuts in the budget.
Okay.
I think it's in RCFS is where the reduction is, because if I look at Claire's BSS, you're actually going up a little bit. So if there's any shift there, it's probably just a recalibration of salary schedules. So what we do on a salary level is we look at all the complement every time we do our budget update, and we recalibrate based on the needs, but there's definitely no cuts there.
There's no actual cut to staff, so there might be new staff coming in at a lower staffing level. Level. Okay, thank you. I just want to be clear. I have a question. So as you know, the Ontario government passed Bill 60 yesterday, which makes some significant changes to landlord-tenant law, and specifically advocates are very concerned it could hasten evictions even more than we're already seeing right now. So on the community social service side, I'm just wondering if you believe that the funding we have in this budget for housing support programs, including housing benefits, emergency funding, and overflow shelter, if we have a plan in place, if there's more pressure as a result of this bill, and do you believe that housing and homelessness has the resources to quickly expand services and scale up if there's suddenly a large uptick? Because we are constantly seeing evictions in my office.
Thanks for the question, Chair. I think yes, I think we have what we need to be able to at least assess and then plan to scale up. This work will be done as part of the 10-year housing and homelessness plan. What we'll need is a bit of time to really determine what the impact of Bill 60 will be on the ground. And we won't know that for likely a few months yet. And that's something that's specifically going to be monitored by the Housing and Homelessness Leadership Table. And yes, we do believe that if we need to scale up or at least move some funding around in terms of our homelessness prevention programs and funded services, then we can work as a sector to figure that out.
And would that include portable benefits for eviction prevention? Like the perfect example that Catherine Boucher put up today. We had a senior resident in her mid-70s who suddenly had a small arrears and needed help from the city, which she was luckily able to get. Would it include programs like that?
Yes, Chair. So what we do really well within the department, again, is work in an integrated way. So Housing and Homelessness Services works very closely with emergency and social services to ensure that we maximize provincial funding for eviction prevention and arrears relief. And that's an ongoing investment. And we will continue to bring to council the scenarios where we would not be able to meet our objectives on housing benefits. That would depend on the funding and the type of funding that will be continuing from federal and provincial governments. So we would be bringing those updates in reports to committee and council as time goes on.
So you have delegated staff authority to find the funding if necessary, if there's a sudden need. I'm just worried if we see an uptick in evictions, sometimes we hear, oh, well, all the COB funding is run out or there's no more portable benefits for the rest of this fiscal year. If we hit that point, do you have to come back to council to ask for more money? Like, how does it work?
Chair, it's really too early for us to speculate on that. We'd have to do that analysis. And yes, we would likely come back to council with some kind of reporting on that. And we will continue to have those conversations with the provincial government, especially in terms of, as was mentioned earlier, perhaps an increase to the HPP funding, the Homelessness Prevention Program funding, which is the proper funding envelope to cover that gap should it occur.
Okay, yeah, because those portable subsidies are really effective. I have a question for Mr. Chenier. I know we talked about porta potties, and I know we also have a public bathroom coming online in Centertown or in Somerset Ward in the next few months. My question is, are there still bathrooms and field houses that exist but are not operational because we're not funding the operational costs to run them?
Chair, there are bathrooms and field houses for the most part. They are operational when the facility is being used for a program. For example, every waiting pool will have a field house, and when the waiting pool is open, in the last 2 years, we've expanded the hours of access to those field houses to when staff arrive to start the cleanup and ready for the pool, and then when they're draining the pool at the end of the day. So we've extended the access hours. There are field houses at some locations where permit holders as part of their permit for a sports field or for an activity area in the park can also get a key to access the field house. What we don't have is ongoing staffing with operating hours built into those field houses to keep them open, 9 to 5 or 8 to 8 or whatever that might be. So, and we have attempted over the years to try to extend the operation of some of the field houses in our busiest parks, primarily district parks, Mooney's Bay, Andrew Hayden, Britannia, to try to extend access to washroom hours to accommodate the large number of people that go there. And as been mentioned earlier, then the other solution is the installation of a porta potty to supplement the operating hours.
So you're saying there's field houses where there are dignified public facilities, but we're putting a porta potty there rather than keep the bathroom open?
Chair, it is much less expensive to put a porta potty in than to staff the facility. We have last year, as part of the additional $50,000, councillors did have the opportunity to spend the funds on staffing a real bathroom, a fixed structure bathroom. Very little of it was done because of the expense. You can generally get a porta potty for a month for the cost of keeping a real bathroom open for a weekend. And so it's a difficult trade-off in terms of value for money to provide service.
I mean, beyond value for money, it's basic human need. And I'm just curious if we've done any costing of what it would cost to just keep bathrooms in field houses open for people to use anytime they come to the park, or at least during park operating hours. Do we have a sense of what that would cost?
It would likely be millions, Councillor. We have probably 100 field houses across the city. Of course, it depends on the number of hours, the number of days a week that you would want to open them. The other issue is these are difficult jobs to fill in terms of, having an attendant there for extended hours. It is possible. Unfortunately, there are no funds. None of these facilities have ever had staffing budgets associated with them. And so they have been available primarily to support an activity in a park, but there's no budget beyond that.
So, but does the entire field house need to be open for the bathroom to be open? Do you need staff sitting there the whole time, or could you just have increased maintenance for some of these bathrooms?
It depends on, they're not all the same, but primarily when you open the door, you have access to most of the area within the field house. Experience tells us that leaving bathrooms open in a park without an attendant is problematic, both from a vandalism, but also from the types of activities that go on. They do require constant cleaning, changing of paper products, all of those other things. And so we would not advise just saying, let's open the doors and let them go to it. Are there other ways? In some communities, the community association has taken on a key access agreement, and they will staff 25, 30 hours a week with volunteers, and that works in some communities, but it requires dedication and someone that is willing to take that on. But in some communities, that is the alternative.
Okay. I would just like to state for the record, I think it's absurd that we have 100 working bathrooms in the city and we're not using them. In any other city I've been to, when you go to the park, if there's a public bathroom, it's open, and it's not just open for an activity, but that is obviously a budget issue. I think this is the cost of austerity. Just a question on park maintenance. We get a lot of questions about the regularity of parks cleaning, including needle pickup. And we've also had a lot of positive feedback about the enhanced street cleaning we've piloted on several major streets downtown. So is there capacity to create an enhanced parks maintenance program to support more cleanup in our downtown parks?
Thank you. The current budget does allow for additional resources, temporary resources and such for the additional parks. So this is about growth in the city. That is the current growth. So growth of parks, additional assets.
So this is not for enhanced cleaning in higher density parts of the city or parts of the city that might be experiencing more social disorder or challenges with homelessness?
Now, when you look at how work is distributed, it is distributed in beats, so it will cover larger areas. So I can't speak specifically to those parks, and we can discuss it with you, but there is some additional resources based on the growth.
Thank you. And just one more thing. I know as part of our climate change action plan, there's conversations about giving more access to cooling spaces. Have we had a serious conversation about extending, in Toronto, when there's a heat wave, I'll often see a post saying we've opened public pools till 11 p.m. and they can do that on a fairly flexible basis when there is a heat emergency. Is that something the city has the capacity to do? Have we costed out what it might cost to do that and also to extend the season?
Chair, we have costed out, and it really depends on the plan that we would put in place, but we have costed out the cost of extending both operating hours for community centers with air conditioning, as well as extending pool time. Our outdoor pools are not lit. This is an issue that's been discussed prior budgets, so they cannot stay open much past 8 o'clock. In the summertime. The issue is primarily budget, but it is also retaining staff for extended shifts on hot days when our pools tend to be crazy busy, and adding 2 or 3 hours to the end of the day does become, we need to refresh the staff at that time. Not impossible. What would and we have said this in past budgets, what would be helpful is going into the summer season knowing that there is a budget so that we could hire with that in mind, so that when the need does arise, we have staff to call upon. It is difficult at the last minute to try to extend, especially if it's for several days in a row. We tend to run out of resources.
Okay, thank you very much.
Chair, I just want to close the loop on Councillor Troster's question. I found it in the book here. So in Dan's shop, in the GM and the BTSS, that's Dan's Business Technical Support Services. There is a savings of 435K. That's made up of 2 components. It's 135K from discretionary savings, and there's 300K from the what we deem as the workforce management savings strategy. So that's the 2 components I spoke about in the efficiency slide. So basically what we've been doing over the past number of years, we've had a discretionary spending freeze in place, a hiring pause in place. Again, you go ahead and hire for for operational things, but non-operational critical services is taking a bit longer to hire. So this is the allocation to this budget for that component. So just a little bit more clarity on the answer.
Thank you for the added clarity. Councillor Carr.
Thank you very much. Just a couple questions for Parks and Recreation. I'd first like to say that this is my 4th budget, but my only budget in which all of my community centers and recreation centers are fully open to the public. So thank you very much for that. It's been lovely to be in Heron Community Center and see the work that all the staff are doing, to see the seniors back there playing bridge. Their sales are up 66% of seniors memberships there. There are so many people there filling the hallways. It's great. And I know we've got community spaces opening up so that we can bring orchestra in there. So thank you very much for all your work on that. I know I've nagged incessantly about that since the moment I was elected. So it's very nice to see the community centers return to communities. So thank you very much. Dan, I have a question about programming. En ce qui concerne la programmation proposée pour l'année prochaine,
in terms of next year's programming, is there a specific increase for French language programming, for programming provided in French? Madam Chair, well, there are no additional programs, specific additional programs planned, despite the fact that we're working hard with our community partners to increase the number of programs we offer. and also to meet the need. Once again, in Francophone or French language programs, we're seeing that despite the program offering, registration is very often low, and that leads to the cancellation of specific programs because there's a lack of people who have signed up for those programs. We're working with an external group and with the mayor's office as well to look at the ways of sensitizing francophones. So we're doing that through school boards, we're doing it through Maison de la Francophonie and other French language organizations to establish partnerships, really, and to raise awareness among people of the services that are available for them. And also to get more information on what would work for the Francophone community so we can better serve them. Thank you very much. I think this is something that's very, very important. About 7% of the population is Francophone. I'm very often receive questions about Francophone programming or lack of it in my ward. There's programming in Rideau Vanier, for example, and my residents tell me that the course is in French, but the actual teacher, the person giving the course, doesn't actually speak French. Many complaints. So I'm happy to hear that you're working on that. Thank you very much.
My colleague, Councillor Bradley, was asking about the cash in year. When I've had discussions with you on cash in year, we've talked about the creation of an equity stream. What is the status of that?
Chair, as part of our work, it is our intent to come back to committee and council with some recommendations on the cash in lieu of parkland policy and how it operates. That that desire to do that has been delayed a couple of times already, unfortunately. It was delayed a first time when the province changed the rules around cash in lieu of parkland and a whole host of other development-related things, and we thought we better catch up to the provincial regulations first. The second delay was to when we understood that the task force on housing was going to make recommendations that would speak to cash in lieu of parkland, what is and isn't taken, and the rules around that. And so that has just come to be. Council has approved the many recommendations, and we will now be able to factor that in. We have committed as part of the, and I believe this was included in the report that came to council, we have committed now to understand what has been approved. And as you know, there are some situations where there will be no cash in lieu taken, or there will be exemptions. Understand that, and then roll that into our report towards early 2027. We will experience what impact this has. Part of this will be to recommend whether we will continue some of the 18 months temporary measures that were part of the task force recommendations, because they will sunset at that point, and we need to know what's next. Do we continue? Was it enough to do it for a short period to encourage housing, and we can go back to regular? All of these things remain question marks that we will be dealing with in the coming year.
Okay, so you're going to be looking at it over the coming year, yes?
Yes, and the commitment in the report is to come back in early 2027.
2027?
Yes.
Okay, excellent. I do think that there is a lot to take a look at. The way that we administer cash in lieu in this city is very different than any other municipality, and I believe that there's some equity issues. I also think that there's equity issues in the way that we give out minor and major capital funding, and as you know, I put a motion in last year for a review of that. I'm just looking for an update on that as well.
Chair, I was remiss in mentioning that the Auditor General is currently reviewing the cash in lieu of parkland And so that too will inform both, how decisions are made, processes, risk, all of those pieces that the AG will look at, we will also factor into our response back.
Okay, thanks. I was going to mention that. I wasn't sure if it was public, but I know she interviewed me. Okay, so the question on minor major capital, though, because I did put a motion in to review that last year. What is the status of that?
We are reviewing that as well, Chair. I don't have a date by which we will come forward on that. Part of that is, of course, tied to the other work on, because all of these programs kind of act as one. But I can perhaps offline talk to staff and see what the timelines are to come back with that. We had made some minor adjustments, I think recommended by this committee, to increase the minors from, I believe it was 10 to 15, and then from 7.5 to 10 for off-site pieces of work. But I'll give you a better idea of timing for that offline when I've had a chance to talk to.
Okay, great. Thanks very much. I do think when we're talking about budget and what we're funding, and I know everything's spelled out for next year, but it's important to understand how we're funding some of the communities with equity challenges. Thank you very much. Appreciate it.
Thank you very much, Councillor. Councillor Brockington.
Thank you, Madam Chair. I'm just going to focus on one last item and follow up on some of the minor stuff after today with staff. And I just want to talk about the Terry Fox Athletic Center. Can staff confirm this is the largest track and field complex in Eastern Ontario?
Chair, I believe it is. I don't think there's anything bigger that's been built in recent times. It is our only track and field center as the City of Ottawa.
Okay, and is this center still in the long-term plans for the City of Ottawa?
Chair, yes, I believe so. Our plan is to maintain and continue to update it. There had been a review to look at a major redevelopment of the site into a more a higher caliber venue. I think the conclusion of that study was that the investment should be put elsewhere if the city wanted to compete for national events, for example, which really told us that our niche is going to be regional, perhaps some provincial, and that's what we should continue to maintain. And there is a list of, because it is an aging facility, there is a list of items that need to be improved at the site.
That was my next question. Once I had you confirm that this is still in our long-term plans, it's a great facility. We probably host thousands of athletes here every year, not just the Ottawa Lions, but all the schools from all the school boards. And Canada Games last year, and I think Canada Games is coming back. So you do a facilities condition index on every asset, from what I assume, and you would know what components of the complex today are end of life or approaching?
Chair, yes, working with infrastructure services, we get condition audits, and we know that, for example, the bleachers at Terry Fox, the hydropower to the site, there are a variety of things that need upgrading over the next several years, and it will be part of the capital budget as we move forward.
So I certainly support that. Sports tourism or sports economic impact in the city is not just based in one stadium or one neighborhood. It's across the city. And the Terry Fox Athletic Center is really something that I want my colleagues to be more aware of. Certainly come to visit, come to the Canada Games this summer, or this next summer. But really, many of the components there are showing their age. And if we want to invest in organizations to host their events in Ottawa, which bring in significant money, we've got to put a little bit of money on the line and invest in this complex. So great to hear that this is in the long-term plans, and certainly willing to work with staff on how we go forward together. Thanks, Madam Chair. That's all from me today.
Thank you very much, Councillor. I'm not seeing any further questions. I just quickly wanted to make a comment. I wanted to thank staff immensely for the work they have done on this budget. Cyril, as you mentioned, this has the highest amount of financial contribution. It also has many tentacles in terms of provincial and federal obligations that we have to make or funds we have to administer. I appreciate the staff who are in the room, the ones who are online, as well as your teams who are currently working to provide those same services. So thank you very much for that. I also wanted to thank all the delegations that were here today, the residents who have reached out to us over the year, because budgets are not made on one day, they're made over the course of time. And I wanted to note that my colleagues are phenomenal as well, because I see the conversations that we've had in the past year reflected in this budget. And while it's an ongoing process and it's never perfect, this is very, very good and beneficial to our city. So we will go through the items and vote on them. First, we're going to start with the direction from Councillor King. Is that direction accepted by staff?
Yes, Chair, the direction's accepted.
Okay, thank you very much. Thank you very much, Councillor King, for that. We will have the technical amendment. Vice Chair, you don't need to read it in. We do have it on the screen. Does anyone have any questions or comments in respect to that, or is that item carried? Carried? Okay, wonderful. So now we're going to go through the roadmap of the budget. I am going to break it into chunks because we do have Councillor Hill who will need to step back with a declaration of interest on 2 items. So I am going to look, actually I should ask my colleagues, is anyone hoping to pull any specific sections out, or can I do it in a group? In group? Okay, wonderful. So I'm going to look at item 1. So that's Community and Social Services operating budget as follows. So that would encompass item A, B, and C, E, F, and G. And we're going to hold off on D. So Councillor Hill, you can stay. Is that item carried?
Carried.
Carried. Now we're going to go to item D under number 1. So Councillor Hill, if you can step away. Okay, is that item carried?
Carried.
Carried. Wonderful. Now we're going to go to number 2, and that's Recreation, Cultural, and Facility Services operating budget. That would be item A, B. We're holding off on C, D, and E. So Councillor Hill, you're welcome to participate in this. Is that item carried? Carried. All right. Now for item C, Councillor Hill, step away. Right. Is that item carried?
Carried.
Carried. Wonderful. You're welcome back, Councillor Hill. It's back and forth here. Huh? Now we're on number 3, Public Works Department operating budget. Is that item carried? All right. And number 4, now we're on item 4, Community Services Committee portion of the capital budget. Is that item carried? Wonderful. We now have a budget. And so that item will come to council on the meeting of December 10th. And I do appreciate everyone's work on that and all the conversation. So I am going to return to the regular agenda. We did have an item an IPD that was lifted onto the agenda. And we do have 1 delegation. So this is in respect to the Anchor program. Forgive me, do we have 1 or 2 delegations committee?
Is it Suzanne and Michelle? Yeah.
So we have 2 delegations. We have Michelle and Suzanne from Centertown Community Health Center. So what I'll do is I'll turn it over to delegations, and I'll open up the floor for any councillors with questions, and then we'll receive the item. So Michelle and Suzanne, if you're there, you will have 5 minutes.
Yes, we're both here. I think Suzanne is starting with a delegation.
Okay.
I think, is Suzanne on?
Oh, hi there. Good
Yes,
afternoon,
good.
everyone. And thank you for your endurance. I know it's been a long day. I've been right alongside all of you today. So thanks very much for the opportunity to speak. My name is Suzanne Obior. I'm the CEO at Somerset West Community Health Center, and I'm here with my esteemed colleagues, Michelle Hertzebys, CEO at Centertown Community Health Center. And I think John Hoyles has also joined us from Central Navigation of Eastern Ontario. And we're just so proud of what we've been able to accomplish in this past year. The first year of Anchor has really demonstrated the value of the community-led non-emergency crisis response. In this past year, we have received 4,464 calls. Our crisis response teams have been dispatched 1,874 times in every sort of weather, to street corners, apartment buildings, parks, houses, drop-in coffee shops, gas stations, you name it. And multiple community testimonials share how the model is working. We are offering residents a meaningful service during moments of mental health and substance crisis. Anchor has received multiple requests for expansion beyond its current service area, and this speaks to the strong reputation the program has built in just 1 year, the community's recognition of its impact, and the clear need and potential for broader citywide reach. We are so pleased to extend our services, increasing more access for residents across West Centertown and the Somerset West catchment area. And we appreciate the city's leadership and recent investment that supports Anchor's expansion. This is an important step toward building an integrated citywide approach to community-led crisis response. These investments will allow Anchor to continue aligning with public health and community safety goals, directly supporting recommendations 44 from the Abdi Rahman Abdi Inquest. And consistent with Inquest recommendation number 44, Anchor will continue to work with Ottawa paramedics and Ottawa police to ensure the appropriate response for individuals experiencing a mental health and substance use crisis. I shall say that Anchor is committed to working closely with Ottawa Police Services to further increase diversion of mental health related calls, advancing recommendation number 8 of the Abdi Inquest. And perhaps one of the most important indicators of Anchor's success is that 92.5% of dispatch calls were resolved without police involvement. This is the model we want to see in Ottawa: city systems and community-based programs working seamlessly together to respond to some of the most pressing social and mental health challenges facing our residents. Getting the right support to people at the right moment can truly alter the course of someone's life and strengthen families, neighborhoods, and communities. And Anchor has demonstrated this here in Centertown and Somerset West, and this shows real promise for neighborhoods across the city. So as council considers the path forward, Ottawa has the opportunity to join other municipalities with delivering a crisis response model that is evidence-based, community-driven, cost-effective, and aligned with public safety goals. We know the challenges facing our residents are complex, and the first year of Anchor has shown what's possible when the city and community come together with purpose and clarity. We want to thank Council, CNEO, Centertown Community Health Center, the Guiding Council, and our many, many partners and frontline teams who respond every day with great skill and compassion in our neighborhoods. Thank you.
And I'm not adding anything to Suzanne's remarks and comments, and would welcome any questions or comments from council.
Exit right to exit 19.
Madam Chair. Sorry, the volume was on mute, so not sure if there was any other questions. And I do believe John Hoyles may also have some remarks as the second delegate.
Madam Chair, should I proceed?
Can
I'm
you just,
I'm not hearing anything here.
we might be having some audio issues in Champlain Room, so bear with us for a second.
Okay, can you hear us now?
Yes.
Okay, sounds good. So what I'll do is, I know that we have a number of hands up. John, I'm going to ask you to proceed with your time, and then my colleagues can ask any three of you the questions but once again, being that this has been a very lengthy day, not that this diminishes the importance of this particular item, I will ask all of us, colleagues included, to keep our questions concise and to the point. So, John, you have 5 minutes.
Thank you very much, Madam Chair. I won't speak about the impact of Anchor. Suzanne has been very eloquent about that. I would simply say on that point, d'accord. For Community Navigation of Eastern Ontario as part of the tripartite partnership delivering the Anchor program, this effective partnership builds on the work that we have at 211 been doing since 2008 here in Ottawa in answering calls from the vulnerable people when they don't know where to turn. Being the dispatcher has allowed us to get to the next level in community navigation, to be able to send communities help to people in the greatest need is the ultimate in community support. Anchor has been doubly effective as in our experience in assessment and handling difficult questions that come to us at the 211, allowed us to connect 52% of the 4,464 calls without having to dispatch the community crisis teams. The success of Anchor is a tribute to the guiding council, the vision of the mayor and council, and their belief and commitment in this work. Ontario Ottawa Police Services support and belief in redirecting calls to 211 was essential. The insights from the paramedics and the community well-being team at the city was crucial in making Anchor happen. I just want to say to council that the support of the city staff, the partnership with Somerset West and Centertown, and working with Michelle and Suzanne allowed us in 7 months to get the program up and running. And as council members, I think, know, we were expecting it to be a slow start. It was more a slam start in that the calls were very high right from the beginning. I would simply say in concluding that I want to thank the council for considering in the budget the increase for us to do some expansion in other parts of the city. And I would just say my personal hope is that sooner than later, Anchor is citywide. Thank you, Madam Chair.
Thank you, John. Thank you, Susan. Thank you, Michelle. There are several questions for you. Councillor Plante.
Exit right 2.
Oui, merci beaucoup. And thank you all for all of your hard work in getting this off the ground. I know it's not always easy or evident to get a program like this going. And I think it says volumes that the councillor for the area speaks so highly of you and the work that you do. I have 2 questions because we talked about this last night at one of the community association meetings I was at. So the first is, there has been an increase in reported violent crime in the areas where you guys are working currently. How do you, how do you rectify that with the stats of the calls and the diversion that is also happening? How are those 2 things happening at the same time? And my second question is, in Rideau Vanier, we have a lot of outreach, right? We have a lot of groups doing outreach. We have a lot of groups doing a version of what you guys do. And I would be very interested at some point, and I don't know if this is the right expression, but like herding all the cats, like getting everybody in one room and trying to consolidate the work you do, the schedules you do, et cetera, so we can better maximize everyone's expertise. So I guess my first question is, how do you réconcilier, as we say in French, the amount of calls with the violent crime? And then the second question is, would Anchor be in a position to provide some sort of leadership to the other outreach groups, or are you guys at your maximum in terms of bandwidth? Thank you.
So I will start by answering, and then certainly my colleagues can jump in. First, I want to acknowledge that and separate the issue of increased criminal activity from the issues of mental health and substance use crisis. While there might be links, they are not automatically linked together as some of those pieces. So we are responding not to criminality, but mental health and substance use crisis. And so if there are increased issues, and I not questioning that information, I think it's important that we separate out those issues, and increased criminality needs to be responded to by the police. We are responding to mental health and substance use crisis. And I think the important part of this is that sometimes it gets conflated in those ways because we are dealing with a number of people who are street involved, and the assumption is that they are also engaging in criminal behaviors, and that is not always the case. We also go to people's homes and apartments and work through some of those pieces. In fact, the evidence shows that when people get early and good intervention, we can actually divert the criminalization of individuals who are struggling with mental health and substance use crises out of the system. The second piece then is with regards to the comments about the expansion and all the groups doing outreach in the Byward Market, Lower Town, Vanier type places, is a couple of pieces. One, we're actually not outreach, so we are crisis response. So when people are in crisis and call in, there is some overlap in that, and there has been some overlap. Somerset West does a lot of outreach. We do some outreach at Centertown. The couple of things is one, we are 24/7. None of the outreach programs that are currently available, I think perhaps the latest one maybe goes to 10 o'clock. We are a 24/7 response. The second piece of that is that we have been working with the city around coordinating some of those outreach responses with the city. So they have brought together all of the outreach groups who are doing outreach, not just in your area, Councillor LaPlante, but all the way from Somerset West, Centertown, and over, because there is a lot of cross-population of some of those outreaches. And we are looking at to coordinate who is doing what, where, when, and how does that fit. But we are specifically that crisis response, and not just for the street involved. So as Suzanne, my colleague, had said, we are going into people's homes and into apartments where people are in crisis and are not necessarily also on the street, versus the outreach is on the street and often to rooming houses in some apartments, but they're not the crisis response.
Got it. Thank you so much. That was really helpful.
Thank you.
Thank you, Councillor Plante. Councillor Carr.
Thank you very much. And Michelle, I just want to thank you for that clarification that you just made there. I think it's really, it was very well said. Thank you to all of you for your delegations today, to the three of you. We talk a lot about how we want to see this rolled out across the city, and I think that would be ideal. In other jurisdictions that have mental health crisis response, what we see is that it's different organizations that support geographically, which obviously you're the Community Health Center for Somerset West, so that's why you have that jurisdiction. So my first question to the delegations, and I don't care who answers, but what would you say that your lessons learned were when you rolled this out, that you would give to another organization that would perhaps take over another geographical district in the future? Like, what were the key things that you would communicate?
So I think I'll take a first stab, and I think that 211 certainly has some other feedback, but I think one of the pieces that is really helpful for Somerset West and Centertown is we're actually doing an integrated service delivery. And so I would highly recommend, and this has been some of the feedback from 211, and my colleague John can certainly speak to this, is that having that integrated service delivery and not trying to separate out, this is a Somerset West call or a Centertown call or a whatever call is critical. It allows us to ensure that there is that consistency of response, of training, of integration of leadership, of problem solving. The second piece is that I don't want that to mean that there isn't an importance of the individuals who are within the community and delivering the services or have those relationships already. A big part of what we spent a huge amount of our time on in our startup period was on our consultations, on our community engagement, of really leveraging the relationships that we had and some new relationships that we needed to build, working with people with lived and living experiences within our community, some of whom we had relationships with, some of whom we did not. And that is essential to ensure that regardless of how expansion is rolled out, in Toronto, for example, where they did have 4 geographic areas and they expanded to the whole city, they kept with those 4 organizations in the expansion and divided up the parts of the city because they didn't want to have more organizations involved related to the dispatch piece. But in every situation, it still needs to be tailored to the unique needs of the community and the users who are living in those community who have mental health and substance use difficulties, because the reality of a center town response is a very different reality than somebody might be experiencing in Carp or in Orleans or in Lower Town, depending on what the resources are, depending what they're living, but also with the different cultural groups and communities that are a part of each of those communities, and making sure that the response is tailored and that the individuals who are the peers responding to it are also coming from and are a part of that community as well.
Okay, thank you. Did Suzanne, or I'm sorry, I forget the gentleman's name, want to add anything else to that? I just have another follow-up question.
John Hoyles, Executive Director, Community Navigation of East Ontario, delivering the 2-in-1 service. I would say, Madam Chair, that the issue of the lessons learned is, first of all, that be ready for the unexpected. I think that's the plus that we bring as a partnership in any expansion, is that there are a lot of lessons to be learned, and we developed a very good program because of our teamwork, but it also being ready to you try to figure out all the permutations and combinations, and we did try, but we realized we probably weren't going to be successful, and we weren't. Within the first week, there were things that we hadn't thought of. So now we got pretty good at what we're doing. So that's one thing. And I was going to comment, as Michelle did, that in Toronto, after a year and a half, they expanded to the whole city, and they just took the 4 operators and just divided up in the quadrants of the city to continue the program. It's not our decision as to what happens here, but the expertise and the experience we've had, I think, is very valuable going forward.
Okay, thank you very much for that. And I just have one follow-up question. How do you kind of evaluate how your service users, their level of satisfaction with the service? Like, what sort of follow-up exists? I would imagine some of these clients are repeat clients, for example, but is there any sort of evaluation process in place where you check in with the clients? I saw that there was some testimonials that were included in our report, but I wondered if there was a bit more robust.
Yes.
Thank you.
Yes, there is, Councillor. Thank you. So part of our evaluation committee, which again is supported by the City of Ottawa, as well as some independent evaluation, again supported through the evaluation committee that is led by the City of Ottawa staff, is that we do ask people if they are willing to provide some feedback about their experiences. We also ask individuals about that they are asked for feedback when we do follow-up services, if they agree to the follow-up services. So for individuals who agree to be followed up, within 48 hours, our post-crisis worker follows up with them and continues to support them on whatever the issues are that are contributing to their crisis state. And so for many people, that is issues related to housing, income, access to treatment, and we work with our partners to be able to connect them with some of those supports and resources. As part of that, we also have surveys that are available for people to do that. Now, one of the challenges with a crisis response service is that people aren't always able to provide that response, or aren't always interested in providing some of those responses. But we do offer that to people, and we'll provide that follow-up evaluation if they are interested in proceeding. I don't have offhand what the percentage is of people who agree to follow up afterwards, but we can certainly provide that information on follow-up if you like.
And if I could, Madam Chair, on the same point, our practice at 211 for that 52% of the callers at Anchor that were not referred to dispatch, we work with them to connect them to help, and we ask every caller, Anchor caller that we do that with, and we call you 24 hours later to find out whether you were connected or not to the service. That's part of our regular 211 work. And so we are able to find out, if they did get connected or not. And if we call them back and they haven't been connected or they haven't gotten what they've needed, we'll work with them again to see how they can get connected to the help that they need.
Okay, thank you very much.
If I just quickly add, I know it's been a long day, but Michelle spoke so beautifully, and John, to the formal evaluation that's in place. But just don't want to lose sight of the established relationships we have within our community and the continuous feedback that we receive both from our clients and neighboring residents in our community. So we're hosting community liaison committee meetings where on a monthly basis, we're receiving timely feedback in regards to the experiences of Anchor, whether it's directly from a client or a resident who might have used it to call for an individual who's in distress. And that allows us to immediately alter, improve, iterate our model based on timely feedback. So notwithstanding some of the formal structures that are in place, there's great efforts to continue to engage with our community and understand what that experience looks like in ways in which we can enhance and or continue what we're doing.
Okay, thank you very much, Suzanne, and thank you, Michelle, and thank you, John. I really appreciated the opportunity to be able to ask you questions about some of the mechanics of what happens, and thank you for all your work in implementing it. I know it's been a tremendous success, and obviously not a counselor for that area, but certainly hear a lot of feedback about it through different partners. So thank you so much.
Thank you very much, Councillor. Councillor Kavanaugh.
Thank you, Chair. Thank you, Suzanne and Michelle, John. Great to the work that you've had to done it, and I appreciated your comments, John, that always something new that you hadn't thought of, but you obviously adapted along the way. The statistic you said at the beginning, Suzanne, was it 92.5% without not needing police? It was just the calls were with the Anchor team. Is that right?
Yeah, that's right. It's a 92.5% diversion. Well, we called it a diversion rate, but really it's that those calls did not require police involvement.
So previous to Anchor, those would have been police calls. Is that right?
We can make some inferences around whether individuals might have called the police, called the paramedics, or not call anyone at all. But as we all know, the premise around Anchor was really around providing options for individuals that are experiencing mental health and substance use crises, and receive community-based responses that didn't require potentially paramedics or police and to respond.
What about paramedics? Was that needed in most calls or not very many calls? What was their involvement?
Go ahead, Michelle.
That is also in the situation that any transfer. So when we look at transfer back to the police, what we're talking about is transfer back to 911. And so that could be to police or to paramedics in that follow-up.
In the infographic that was provided to council, only 3.8% of the calls of the 1,800 and so that were dispatches made, only 3.8% where paramedics needed to be were actually requested. 3.8%.
Okay, all right, thank you. Now, appreciate it. I know this is very needed. In terms of those calls that did require police or paramedics, so they would have gone through 911, is that correct?
Well, one of the things that we have is that we have a relation as part of our relationship agreement. The 911 has a way of being able to transfer seamlessly to 211 if it's a call to be transferred there, and 211 has the same relationship. We also have as our staff who have a requirement for either paramedic or police backup that we are able to reach dispatch, not as general citizens, but as system partners who are calling for support and backup.
Okay, thank you. I mean, a lot of this started because of the case of Abdul
Yes.
Rahman, and which was police, and would have been helpful to have another component. So it's interesting that most of your calls, as you said, don't require police at all. So I appreciate hearing that. I think that was not expected in terms of what we thought would be the result. But it's good to know, and I hope to see this program grow. I think it's needed everywhere, because I don't think that these crises of mental health crises are a citywide issue. We know that. So thank you very much for what you're doing.
Thank you, Councillor. Councillor Troster.
Thank you so much. I am so lucky the anchor is in my ward, and then I get to work with the wonderful people who are on this call, plus all of the incredibly skilled crisis workers. I've met many of them, and I've interacted with the service myself. And I just wanted to say that this program has been in a process of continuous improvement. So there were definitely a few wrinkles when it first launched. I mean, the folks at 211 weren't necessarily used to answering a crisis call. They were used to answering more of an information call. And I know there was some requests to shorten the questionnaire and to, dispatch quicker. And I have to tell you, there's been a big difference. I called early in the program. I had one experience, and then I called the other day, and I was like immediately able to get through to someone. The questionnaire was very short, and I was able to, they were able to dispatch someone. So that was super, super helpful. I am just wondering, given that the Abdi inquest recommended providing funding to evaluate and expand the availability of Anchor, and Anchor had a successful first phase, there is a modest amount of money in this budget to begin looking at another neighborhood. But I think certainly within the urban and suburban transects, I'm hearing from everyone that they want this program in their community. So given that the current Anchor funding expires in March 2027, and that this year's budget would only expand into one community, how do we set ourselves up for the long-term sustainability of the program? And what do you think is a realistic timeline for, if the funding were in place to be able to scale, if not citywide, at least within the urban transect?
So thank you, Councillor Troster, and thank you for all of your support and feedback along the way that has enabled us to continue to do that continuous quality improvement. So definitely the three of us have discussed what expansion would look like. We have not, though, done any costing or scaling related to that. We would definitely need the time continue with the community engagement, as we have said. I think the city itself.
You froze, Michelle.
I think you just froze.
Needs to provide some direction about what to spread for staff, and I know that they have also been giving some thought to that. For us, we did the launch of this, which was a lot of heavy lifting of the initial policies, procedures, and recruitment. It does take some time, and we would like as much notice as possible. I think we've got maybe 19 months left in the current existing contract with where we are, and would like to start work on what possible expand be for the whole city, or even, as you said, within the downtown urban core. Although I will tell you that talking to my colleagues who are in more rural areas at both the east and west ends of the city, the need for this service exists as much as it exists in the downtown core. It just looks different because a lot of it is happening more in the homes and in the apartments of those communities.
Well, I imagine it would involve a lot more driving, and response times might be different because things are definitely farther away from each other. One last question. I know that when the service originally launched in the wake of the Abdi incident, and the thinking was really around mental health crises, but certainly in Centertown, it's the substance use crises that have really skyrocketed. How have you adapted Anchor, given that the need was different than what you envisioned when you first got the contract and launched the program? Like, how is Anchor adapting, and are there additional resources or considerations that you need?
So I think one of the biggest pieces is, and this is, the strength of both Somerset West and Centertown working together, is the importance of, we have spent a great deal of time being able to train staff on the use of substances such as naloxone, but also in interacting with individuals who are having a substance use crisis and may not necessarily be fully responsive to the presence of the peer workers who are arriving on the scene. We have also had to spend, I would say, a lot more time and resources in debriefing and providing post-incident response for our staff. While we have had 0 incidents of violence against our staff, like none of our staff have been harmed during the provision of Anchor services, we have had to spend more time supporting staff and debriefing incidences where individuals were found and supported in various states of overdoses and needing to resuscitate. In some of those instances, they have absolutely called for backup of the paramedics, but they are still the ones who are trying to keep someone alive and from an overdose, to be able to get them the additional help and support that they require. And that takes a toll on everybody who is responding to that incident. And so I think, that was a little bit more of a surprise for us in terms of that level of response. We want to keep our staff supported, feeling healthy, that they're able to debrief critical incidents as they happen. And that has been really essential. We've also had a number of individuals, and this isn't necessarily about the substance use crisis, but we've also had a number of incidents in the area where we have been providing post-incident support, where someone in the community has died by suicide. And, there have been times when some of our staff have witnessed some of those incidents, not because they've been called to it, but because they've been attending to something else in the same building, and then providing support to individuals as well as requiring support themselves. And so, I think part of whenever you're providing, and certainly our first responders in police and paramedic have spoken to this, the importance of being able to get support post-incident around
Frozen again, Michelle.
It looks like there's a bit of freezing.
Crucial, and additional training with regards to the toxic drug support.
I think we're getting the gist, Michelle, but you are freezing at the end. So
I'm going through a dead area. Suzanne can fill it.
Yeah, no, I would want to add 2 things. And, thank you, Councillor Troster, for your tremendous advocacy and support in the context of, really watching members in our community struggling as it relates to precarious housing, being unhoused, and living with mental health and substance use crises. The staff are incredibly committed to being able to respond. And as you can imagine, we're needing to think through and become quite responsive in keeping our staff healthy in that work. And so, Councillor Carr, as you're asking about some of the lessons learned, it's really around how we find sustainability in keeping staff healthy as they respond continuously to crises. And really interested in continuing to have that conversation with the city. I think the other piece that we don't talk enough about is the unseen crisis in many homes, particularly around families who are racialized communities, of newcomer communities that live through crisis in more of a hidden way. One of the greatest strengths of Anchor is prioritizing hiring crisis response workers from a diversity of communities to serve communities. We've aimed to reduce stigma and normalize conversations around mental health and substance use crisis in a number of communities where that conversation is not something that's easy to have. We've been able to stabilize housing for many newcomers who have struggled with being able to find housing, to navigate the system, to navigate the paperwork, while also living with mental health and substance use crisis and not having the language to describe, what their realities are. And I think there's still quite a bit of work to do in the context of wanting to ensure that we minimize individuals who are struggling in silence and or struggling with being able to speak to what a mental health crisis is because of potential cultural values and belief and or system responses that aren't yet well equipped to respond to some of those cultural realities. And quite proud that Anchor has been centering that in its service delivery model.
And Madam Chair, if I could, for Councillor Troister's question about capacity for expansion, I worked very closely with our colleagues at Find Help 211 in Toronto, and they relayed to me their expansion experience. And the fact is that we have spent a lot of time in developing the procedures and processes with Centertown and Somerset West and ourselves, so that the basic infrastructure is there, the 211 infrastructure is there. And I think Michelle hit the nail on the head in terms of any expansion. It's the engagement with those communities to make sure that everybody is going to be, on the same page and working as a team, so that again, that core is there. And it's, I guess it comes down. It's part of the equation is about the money to be able to do it.
Thank you so much. Thank you so much to all of you. I'm so lucky to be working with all of you on the Anchor program, and I'm very excited to see we will be scaling, at least modestly, in this budget, but I hope to be part of the force to scale this citywide, because the results we've seen in Centertown are really incredible. Thank you so much.
Thank you, Councillor Troster, and thank you all for your patience in remaining here, Michelle, Suzanne, and John. This is a very important item for us to talk about, and I think that it brings great value. And I too want to see it extended across the city. I think that's all of our goal, is to see that done. So thank you very much for hanging in there.
Thank you.
For answering our questions.
Thank you. Thank you very much.
Wonderful.
Have a good day.
So colleagues, is that item received? Received. Thank you. Are there any notices of motion? No, seeing none. We do have an inquiry from Councillor Brockington. It's an IPD. Do you need to ask staff questions? Yeah. Okay. I think we're golden. All right. So we do have an inquiry from Councillor Brockington. I'll read it in. With the financial contribution from the Ministry of Sport in October 2025 to be used for the expansion of the near 60-year-old Alexander Community Centre, would staff and Recreation, Cultural and Facility Services please identify the major stages required to complete the renovation and expansion project with associated timelines? Is there a date that requires the provincial contribution to be used by? Okay, and wonderful knowing that that Dan's not here. He has to accept it regardless. No, it's an inquiry. All right, so we are good. There's no other business. Our next meeting is February 24th, 2026. Is this current meeting adjourned? Happy Budget Day, everybody. Thank you.
Good share.